Okay, we're ready to go?
We are.
All right, good morning, everyone. Going to welcome everybody to our Board of Supervisors meeting on 4/28/2020. This is our, I think our fourth virtual meeting, so we'll go ahead and get started as usual. We'll start with a moment of silence. Do we have any dedications today? Hearing none, we'll start with a moment of silence. Okay, Supervisor Crandall, would you lead us in the Pledge of Allegiance, please?
Yes, ready, begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. All right, moving on to item 4.1. Do we have, are there any extra items that were posted that were not appearing on the posted agenda today? Do we have any extra items?
Yes, Supervisor Simon, there is one extra item.
Excellent. That is item 4.1. Okay, Carol, are you going to present this item? Or? Oh, we need to take it up for a vote. I apologize. All right, there's an extra item posted on the agenda. In the fashion we need to, whether or not we're going to take up this extra item of discussion with the board or formal action.
Mr. Chair, I'd like to make a motion to take up this extra item as it came to our attention after the posting of the agenda and it needs to be heard before our next regular meeting.
What is the justification for it?
We didn't know about this till after the posting of the agenda and that there's a timeline on this. We need to get this letter out asking for an extension. So that's why I'm hoping to have this on the agenda today.
Okay, what was the letter again?
The letter is for the restaurant delivery for the senior restaurant. 4.1.
It's 4.1. It was posted this morning. If you update on your Anarchist, I think you pushed the button.
No, I haven't. Just the public needs to know what it is that we're discussing before we take it out. So,
is Tina, would you like to read it, or is Crystal on that would read this, or Carol?
Sure. How much? I'll read. Okay, go ahead.
I'll go ahead and read the item. So it's a consideration of extra agenda item. And then B, consideration of a letter to Senator McGuire and Assembly Member Aguiar Curry requesting they urge Governor Newsom to request a 3-month extension from FEMA for funding for the restaurants delivering home meals and senior programs.
Okay, so the question I have is, because we have to be able to justify having this as extra, this has to be dealt with for next Tuesday or otherwise it expires?
It's being discussed right now in the legislature, and so a decision of no or yes will probably occur before next Tuesday.
Okay, because I'm not hearing that we're presenting it to the board, so that's why I was curious.
So if I could add, Supervisor Scott and Crandall and Crystal Martin and I met yesterday to discuss this brand new program. The guidance on it is very minimal at this point, and if is to have any opportunity to implement this program, we need more information. And right now, this program is set to expire on May 10th. It wouldn't be feasible to stand up a program that is going to go away in less than 2 weeks. And given the urgency of the need to figure out how to implement this program, the recommendation is that your board take it up as an extra so a letter can immediately go to our state representatives urging the governor to get an extension. If an extension could be secured, then it would enable staff to explore the feasibility of the program, what the costs would be, how to staff it, et cetera.
Okay, so thank you for that. That's the legal requirement that we're required to have in order to vote on an agenda item rather than just say it's an extra and we need to do it. So thank you, Carol, for that.
Mr. Chair,
Yes, go ahead, Bruno.
I just want to interrupt the conversation for a second. I'm being told that we're hard to hear on Facebook, wondering if Sam can let us know if that is a problem. Do you guys hear me just well?
I'm getting the same feedback that it sounds like we're in an echo chamber.
I don't know. I'm not listening to it on Facebook.
So people that are advising us, let us know if it sounds any better now after Sam made that change. I'll let you know, Mr. Chair, in a moment.
Okay.
The item at hand, if your board wants to consider taking this up as an extra, okay. And by the way, I'm hearing the sound is good now. So if you want to take it up as an extra, my recommendation would be that you take that action now, but discuss this item a little later in the agenda.
Absolutely. All right, so we'll bring it back for action of the board if actions be taken. Supervisor Crandall?
So, yeah, I just was gonna, I seconded her motion, so.
Okay. All right, there's been a motion and a second to take up this item as an extra. We'll go ahead and call the roll call vote.
Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Yes.
And Supervisor Simon?
Yes.
Thank you.
All right, thank you very much. And we will take that item up later. What I would like to do today, which is going to be a little different than what we've done before, we're going to go ahead and move on to our 901 item before we do the consent agenda. And the extra item, we're going to go ahead and move on right to Dr. Gary Pace's update for COVID-19. So we're going to go ahead and move right to, I apologize here, item 6.1, our 901 item, consideration of an update for COVID-19. So we're going to move right into that. Dr. Gary Pace, go ahead and take the floor. Thank you.
Good morning. Thank you, Supervisor Simon, and good morning to everybody. We'll give can you hear me okay?
Yes.
Okay, great. I'll go ahead and give the update today. So basically, in the United States, we've crossed over 50,000 deaths now due to the COVID that we know of, and it's probably quite a bit higher than that. Just to put this in context, was a lot of talk early on about how the flu is more dangerous than this, but now we're entering into the range of the number of deaths that we get in a bad flu season, and we're not even close to the end of it yet. And this is occurring in the context of a pretty severe shutdown for everybody. In California, there's been 45,000 cases, about 1,800 deaths. The numbers are slowing in the Bay Area. They're continuing to rise down in LA, but about half of the cases in California are down in LA at this point. Sonoma County has over 200 cases, and there's no new cases in Lake County over the last week. In Round Valley, up in Covelo, they've had a small outbreak of 6 cases up there that is being kind of watched closely. So the biggest news in the last week was we loosened some of the restrictions through an order that came out on Thursday and a clarification on Friday. So the idea was to open the door a little bit so that some more activity could be happening in the counties, a little more mainly recreational activity. The goal was to slowly try to open things a little bit so that people could get outside a bit more and have a little more freedom, but still maintaining the social distancing and keeping things safe. So a lot of the process of thinking about these things is trying to get a little more activity while kind of limiting the influx of people from outside of the area, and also being able to maintain the social distancing and basically not getting a huge surge of cases 2 weeks down the road. There's a kind of a complicated process going on right now in the state where the governor's orders are in place. We cannot be more relaxed than the governor's orders. He's giving hints that he's getting ready to start loosening things, but there's no timeline. It looks like it's probably going to be a couple more weeks. The order that's in place in Lake County expires next Monday on the 3rd. My intention is to probably just continue that order now for a couple more weeks at the current state. We basically loosen things a little bit, and then each step we loosen, we have to wait a couple weeks to see if we get a rise in cases, and also to see how the activity goes. If we start seeing a lot of groups coming together, a lot of mixing, then that'll be a problem, and we'll probably have to back off a little bit. Probably the process over the next months is going to be a slow relaxation of the restrictions every couple weeks, seeing how things go. If we start seeing surges in cases and it starting getting close to overwhelming the hospital capacity, we'll probably have to clamp back down. So it's probably going to be this relaxation and contraction kind of off and on over the summer. Hopefully everything goes well and we're just able to slowly get back to some more semblance of normal. I really don't think there's going to be large group activities or anything like that in the near future. So large church gatherings, probably high school graduations are not going to be happening in any kind of way that's familiar. Music events, county fairs, those kind of things are probably not going to be happening this summer. So I want to update a little bit on kind of the preparations we've been making. The main thing that we've been trying to put some energy into is getting the testing up. As we loosen these restrictions, the testing needs to get better. There's two kinds of testing. One is the viral PCR testing, and that's the one that's most available now, and that's the one that really helps us determine who's infected and how to contain the infection. The second one that you're hearing a lot about in the news is the antibody testing that tests for immunity or tests for previous infection. That's very new. There's a lot of inconsistency in the testing. It's not really available in Lake County yet, although it probably will be in the near future. The commercial labs are starting to get those ready. And most of the things you're reading about in the news are either labs done by research universities or kind of commercial labs that are getting these machines out quickly. And those are not very valid at this point. They're not very well replicated, and they're not particularly useful in a clinical way. The limitation to testing in Lake County has continued. We've done somewhat over 400 tests in the county or on county residents. And the main limitation has been in the sampling supplies, the swabs and the transport media. The state has now made significant progress in getting some of it, getting swabs, and they've got 100,000 this week, and they're supposed to get another 200,000 this coming week. And so they're starting to ship them out to the local jurisdictions, and we now have some that we've been able to get through Amazon and some other places, and we're just starting to get them out to the healthcare facilities now to try to encourage them to be testing more. We're really working on trying to expand the testing to where people that are mildly symptomatic or people that are healthcare workers or other high-risk people can get tested. We have done a fair amount of surveillance testing now. There's been in all the nursing homes, there's some staff have been tested just asymptomatically, just to screen to see if anybody's carrying it that we're not aware of. Sheriff Martin has tested pretty extensively at the jail. All those are negative. We're in the process of doing some of that. We've done some surveillance testing in the community, all of which was negative. So the supplies we are making progress with that. The second piece of the testing part is actually getting the samples. And normally the way that's done is with the medical community, the medical providers. So if you need a diabetes test, your doctor will order that and you'll go get it at the lab or something. And so that's kind of what we're trying to set up here. The medical community has been very conservative in who they've been testing, and appropriately so, because there haven't been enough supplies. Now that the supply chain is opening up a little bit, it looks like we're going to be able to get more testing here in the near future. And if people have trouble getting tests and they want to get tests, I encourage them to contact us at the health department, and it'll allow us to sort of help the medical providers unstop any blockages and get that going, because that's really important as we try to loosen things up to make sure that we're not getting outbreaks that we're not aware of. The other thing is the lab capacity that seems to have opened up as well. So there seems to be capacity to do the tests. It's mainly just getting the supplies out to the right people and getting them to sort of change the way they've been testing, because they've been having to do it in a different way previously. No new cases in the past week, despite continued testing. Is doing well, and the last case is coming off isolation in the near future. We've been working hard that whenever a case is identified, we do the contact tracing, the isolation, counseling and support, and check in with them pretty much every day. And this has been going well, and our nurses are doing well, and we've got some volunteers that are also helping. We really appreciate all the efforts that have gone in that. The surge preparation is one of the things that a month ago was a big part of the conversation. What's going to happen when the hospitals are overwhelmed and there's more people coming in, there's not enough ventilators and all that. Now it looks like, because of the changes that have happened and the different projections now, that there are less people that have gotten sick than we expected because of the sheltering in place orders. We're changing the strategy now, and we were starting to look towards putting up some facilities locally that we could use to deal with the overflow from the hospitals. And the hospitals were all working hard to try to come up with surge plans. And now it doesn't look like that's going to be the primary need at this point. It looks like as we are able to go forward, we hopefully will be able to manage the number of cases by the amount of social restriction that's going on. And so there is the closest state-run facility now is down in Sacramento. It's a sleep train pavilion. They've set it up as a alternate care site, and most likely what we'll be needing to do is, if we do start seeing a lot of cases, rather than setting up big facilities locally where we don't really have the resources or the staffing, to have them go to one of these other sites. So I think, the one other thing is just, there's been questions that come up pretty regularly, it's a really good question about how do we want to think about if the fires start coming and we're still in this situation where COVID's around. And so we're starting to get ready to do some planning about that. Dale and OES is going to set up a meeting in the near future where we can start talking about how we think we'll need to manage this thing if the fires come and we're still with the COVID and some of the social distancing restrictions going on. So I think the main thing to talk about today, and I think probably what most people want to hear about, is loosening the restrictions, how we're going to go forward here. It's been a huge lift for everybody over the last 6 weeks to have to deal with this. The school's closing, the business is closing, and I don't have kids at home right now, but I can't even imagine what it's like to have young kids, trying to manage them and being locked in the house, or if you're not able to work, and all that goes with that. So we're very aware of that, and we're trying to figure out how to move forward. I think that it's a balancing act between loosening up so the business can start back to more normal kind of commerce, and also more social interaction, and just kind of having a more normal life, and balancing that against the public health risks of people coming in contact. It seems pretty clear that large groups, mixing of people, density of people is where the problem is. I think we have a lot more evidence now that it's the density and the interactions of lots of people that is where the biggest problems come in, and where you start seeing the explosive rises of infection. So we are under a state order. The state order is the one that takes precedence, and we are not able to loosen more than that. And the governor's we've been in a lot of conversation. A lot of the northern rural counties have been in conversation with the governor and the health department people that they really need to treat us differently than they do Santa Clara or LA. It's clearly a different situation here. The economies are different, the economic needs are different, and the risks to people are different. And they seem to hear us, and they're it's unclear exactly how they're factoring that into all their discussions. They're not tipping their hand very well. You can see in LA right now, the death rate is continuing to rise. You know, they're still in a fairly uncomfortable situation with the infection continuing to rise and the death rate rising. The Bay Area is not in a similar way. And since we border with the Bay Area and we're so rural and the density is so much less, I think our risk factor is a lot less. The way I'm thinking about this is our strategy moving forward will be to loosen slowly. And when a case does come up, that we have adequate testing, that we can pick it up, and then we quickly move in, do the contact tracing, cordon those people off so that we can slow the spread throughout the community. Again, I've said this before, but the goal is not to stop the spread, not to stop the virus in the community, because that's an impossible goal. It's really to slow it so that it's manageable, so that the hospitals can manage the surge, and so that we can protect the vulnerable people in the community. So our order expires May 3rd, next Monday. My intention at this point is to continue the order as it is for another 2 weeks, so probably to make it May 17th. And during that time, we'll be able to see what the governor's doing. We'll be able to see what Sonoma County is doing, what the Bay Area is going to come out with some announcements in the near future, and also what Mendocino and the other folks are doing. We did loosen up a little bit, and now we can see how it goes over the next couple of weeks. It seemed to go really well this weekend. From all reports, people were out and doing some things, but they seem to be kind of sticking with the social distancing, and we really appreciate that, because you could see in other parts of the state where they did open up some of the beaches, and it got pretty crazy looking down there, and the governor was definitely scolding people a little bit about that. But I think we should be proud of how the community handled this, and that's very optimistic moving forward, because if it gets too crowded, too flouting of the rules, then we probably are going to have to back off and do more manageable restrictions. So this is a good sign moving forward. I think the governor is starting to lay out a whole framework of how he's thinking about moving forward. And we've been working on this in the county as well, and it seems to pretty well ally. He's kind of laying out a 4-stage process. We're in stage 1, which is the sort of the preparatory stage, getting on top, getting control of the outbreak, and then starting to get some things in place that will allow us to manage it as we go forward, including testing and contact tracing, isolation management, and all that. So we're in the process. We're pretty good with that, except for the testing, and we're working really hard to try to get that in place. The second piece of that is sort of making sure that the workers and the public can be safe when they go back to work. So that means having adequate ability to social distance at these different workplaces, having PPE if that's needed, those kinds of things. The third part of it is the workers can have adequate sick leave. So if they get ill, they don't go to work, they can come home, having childcare so that if people go to work, that their kids are taken care of, those kinds of things. So as we get all that in place, then he's sort of making this idea about then you can go through the door into the second stage. I think for the most part we're there, except for getting a little bit better testing, which I'm hoping in the next week or so we get. The second phase is going to be allowing some of the workers to go back to work, and it's really, he seems to be kind of focusing on the economics and getting business back in place, which is, hugely important. And so, they seem to be sort of basing this not so much on essential versus non-essential anymore, but based on risk. So if people can go back to work and not be in too much risk and not put the public at too much risk, that's going to be one of the first things that goes back. So it's probably going to be more like people in that are in more one-on-one kind of workplaces, and that we can kind of limit the number of contacts that they have. A lot of this is going to probably be around limiting the number of social contacts, where if you were infected, that it would spread to 5 people instead of 100 people in a day. But again, it's very early sketches. I'm just trying to sort of lay out a little bit the way they're thinking about it. And then it moves forward to stage 3 and stage 4. Stage 4 is getting back to normal with large group activities and things like that, which is probably months away. We can't go faster than the governor. So I know there's a huge interest in the community to open things up as fast as possible, especially around work and around the lake. And we just, it's just not possible to do that legally. So there was one other point I wanted to make there. We are working locally on trying to figure out ways to help the businesses open up. We're putting together a template at the health department that different businesses can get their hands on. It should go up on the website tomorrow, and where they can kind of go on there and start sketching out a plan of how they can keep people safe at their business, and then submit it to us. And then we're setting up some kind of group that's going to look at it and take, for example, all the cosmetologists' recommendations together and see if we can put together the best one, so that as we start opening, we can sort of use this as a way to help people keep it open their business, but keep it safe. That's sort of the goal here. And one other thing that's come up quite a bit is about masking. The way we're doing it right now is I'm strongly encouraging people to wear masks when they're out in public. I do when I go out of my house. I wear it when I'm out, and I haven't made it mandatory yet. Other counties in the area have made it mandatory. We really want people to do that. I've been reluctant to make it mandatory yet, just so that, because I think as we start loosening this up, then it probably will need to be mandatory. That's going to be one of the things we put in place to help keep people safe as we loosen things up. And I was sort of allowing people to make the choice now, and that may or may not be the best idea, but that's the way we've been doing it at this point. But probably as we start loosening up more, then I would expect the need for mandatory masking to go in to keep people safe. So just to kind of go over a few of the specifics around opening, and then I'll be pretty much done, is so with the lake's a big deal. We were a little slower to close the lake. We were trying to just keep it to locals the first time around, and the lake was packed that weekend, and so I felt like I learned a lesson that we needed to just really clamp down. And so now we're in the process of just slowly trying to open it up. And this is a very imperfect science, and we're trying to open it enough so that local people can get out and get around and get a little bit of relief without encouraging group activities, without bringing people in from outside of the area, from areas where there's more infection, and without having a lot of, basically so that we don't see a big surge in infections a couple of weeks down the road. The way we chose to do that was having fishing on the banks, keeping social distancing, having a little bit of boating, which was basically non-motorized boating, but not sailboats. And you can't fish from the kayaks or the canoes, basically just to try to keep it manageable at this point, to open it a little bit, but not too much. Golfing with certain restrictions, certain other activities you can be outside hiking, jogging, things like that. So it was really trying to pick activities where people could be solo or outside without interacting a lot, and without opening it up for a whole lot of influx from outside of the area. You can certainly make an argument that fishing from a kayak is not any more problematic in terms of social distancing than just going out in a kayak. And I understand that, but there are big groups down in the Bay Area in San Jose and Sacramento that come up and do fishing from kayaks, and we were just trying not to make that so attractive for them. The other thing about the lake is that the other lakes in the area, Lake Berryessa and other places, we want to kind of coordinate any further opening with them so that it's not like Clear Lake opens up before the other ones do. And so then everybody from those areas that wants to get outside on the lake comes here. So, we're trying to be methodical about this, keeping people safe, but also opening the door as a little bit as we can. The economy, we've talked about that some. There's a lot of effort going into this. The governor's working on this, and we're pretty much waiting to see what he's doing. We're working on it at the same time, and then trying to align with what they're doing. If people are interested in this, he gives these press conferences often at noon. I'm not sure if it's every day or not. And yesterday, I thought he was going to give some big announcements, but he didn't. But he said that they were going to be starting these business roundtables starting today that are virtual that people can get on. So if you check on that, if this is something you're interested in, that may be a good way to tap into that. The schools are another big deal that we're talking about. It would be very helpful to get some of the schools able to have small groups of kids, stable groups of kids through the summer, where some of the kids can catch up a little bit on the education that they've lost. They can get some socialization. It will help the parents when they start going back to work. The problem is that the funding for summer schools has been eliminated. So the state's going to have to help with that at this point, and they haven't come up with anything yet. So, the schools were working hard to think on some of these plans on what those things might look like. And, we're just kind of waiting to see how things go as we're trying to plan behind the scenes. High school graduation is a big question. I think probably, we've been talking about it. I've been talking with the county, the LCOE, and also with the superintendents a bit, and they've been trying to be really creative about thinking about ways to do it. At this point, I think it's unlikely that we're going to be able to have any kind of even modified graduations. There's talk about trying to do drive-ins or trying to do small groups that only 10 at a time or something like that, and just making it last a long, long time. The logistics of that are pretty overwhelming. The likelihood that we're going to be able to keep the kids from gathering and doing things like that is probably pretty low. And I mean, I'm recommending that all the schools work towards a virtual graduation, and then at least through June, and then maybe later in the summer there might be a possibility for some kind of a modified thing. But we're in discussion about that. I'm just sort of saying that to kind of get the messaging out that people are working on it, and there's just don't seem to be many good options that are safe, that aren't going to just really risk a big resurgence of infection out there. I think those are sort of the main. Local government is another thing that's been part of this whole process of discussion. And, how do we get some of these functions back in place in a safe way? And the discussions are going on about that as well. So, I think that's over. I'm sure there'll be a lot of questions, and I know there's a lot of frustration out there, and, it's a difficult time, and I think it's not over yet, but it is getting better. And I was really, really happy to hear that people were able to get out some this weekend and were able to manage it in a way that didn't put a big risk out. And I also want to thank the local healthcare workers and the local nursing home folks and the hospital folks, because they're working hard to keep things going and keep things together as well as everybody else in the community. So thank you.
Thank you, Dr. Pace. Supervisor Brown.
So a couple of things. I know you talked about working with a group. I don't know if that's the group that you guys formed last week, but a lot of these things that you're that you were talking about are things that we brought up to you. So I'm assuming that you're talking about the information that we gave you or that we've sent you regarding the plan to set for different businesses. Is there a chance that maybe we could get you to join our blue collar committee meeting on Friday at 10 o'clock?
Sure.
We could even schedule it at a different time that would work for you.
Yeah.
Maybe that would be a perspective at least that you could get from the group that's actually creating these plans that you're talking about.
Great. Yeah.
Okay.
Let's work on the time, but
okay. Yeah.
I'd like to do that. Yeah.
Yeah. We're all pretty flexible. Eddie, do you think that's a good? Yeah, I think that would work for us. So, and it's a good group. They're not gonna, you're not gonna get beat up or anything. They just have some suggestions, and you basically give you an idea of how the process works for, how we're coming up with different plans that are reasonable depending upon the business. I think so. So yeah, you're not going to get set up or anything there. I think you'll find some value to it. So the other thing is, so you're talking about working with the state or with other counties to get the state to open up a little bit. Did I hear you right on that?
Well, I think it's pretty clear that the governor is trying to do this as a statewide thing, and the experience and the needs is just really different in Lake County than it is in LA, say, so the northern counties, the rural counties are becoming more and more vocal. I think as we feel the pressure from the folks in the community, we're trying to encourage them to let us have more autonomy. And they, up to this point, have not really been, they say they hear us, but we're not seeing any movement. I think the sense is that probably at some point in this process, they're going to start allowing a little more autonomy, but they're not at this point. And we're trying to ask, and I know last week there was a letter that came out of the board that was, and I think that's the kind of stuff that we need to be presenting to the state so that they can hear the frustration and really get how the economic needs are just, our needs are different from Silicon Valley, let's face it. And so the public health risks and the economic risks are just completely different. And so we need to try to have a little more autonomy. Yeah.
Yeah. No. Okay. So I get that part of it. The thing I'm confused about is that our restrictions are greater than the state. So if we're wanting the state to let us have autonomy, let's at least lift the restrictions that we have that are greater. And, the lake is one of those, we'll get to that here in a minute, but I'm not, it seems to me like we're telling them to do something when we're not doing it ourselves. And so maybe we should consider that. And I know he says he's focused on economics, but there's a difference between a bureaucrat, lifelong politician who's never had another job talking about economics that actually generate money for the state, as opposed to us that are focusing on economics because our residents and our constituents are actually losing their livelihoods. So I think we're coming from completely different points of the planet or even universe when it comes to comparing his focus on economics and our focus on economics. So, I think we need to keep that in mind. And the thing is, there's two sets of businesses out there. One, besides the essential and non-essential, one wants to stay closed because they can't safely open. And there are those that can safely open but are not allowed to. And those folks, I'm surprised they haven't realized yet that nothing's going to happen to them if they open. They'll be in violation. Big deal. Who's going to arrest them? Who's going to cite them? No one's going to prosecute them. The court's not going to hear their case. And if I were in one of those businesses, I would open, because this is nonsense. We're already, the sheriff and the other law enforcement have already demonstrated their ability to use the discretion based on staffing and different things like that they can amend their policies to enforce them the way it fits for for the resources that they have available. They have mail-in complaints now. They have a lot of policies in place that allow for the concerns that they have for staffing. This is no different than that. I mean, is the sheriff's office really going to go out and arrest some business because they're opened up to sell clothing? You have stores in Clear Lake and here in Lakeport that actually have clothing out on the sidewalks on racks for sale. Yet clothing stores are closed, and clothes are essential. So I don't need the governor to tell me his definition of what's essential and not essential. Essential is what you need when you need it, not what the governor says I need. And so, I think these businesses are going to have enough of it, because here's the thing that we're not talking about. We're doing a really good job of protecting people from this virus right now. And like you said, you stated it clearly. I was going to bring that up, but you did it. That our goal was never to keep them from getting it. It was keep the surge from happening and overwhelming our hospitals and all that. Well, in the meantime, we have empty hospitals, and we just had a report from the health department 6 months ago or so talking about how we were it was debatable, but they said that based on studies, we're the poorest health of any county in the state. Yet we're closing all of our hospitals to all these people that are supposedly sick. That makes no sense. We've got people, and I realize that, knee surgeries aren't life-threatening or anything like that, but if you've ever needed one, you would understand the need to have it. And so, we're delaying all of these things it's all we're doing is delaying them. So the hospitals are going to be overwhelmed at some point while they're empty now and going broke just like any other business. So, I think we need to open up. We need to get things going, get things moving, and get ready for what I was going to talk about, the next surge that's inevitable. I'm no doctor. This is my opinion, but it's an opinion based on a lot of facts that I've seen and experience from flu season. This thing's going to come back around. If it's not, tell me I'm wrong. It's going to come back around in another cycle next flu season, and then we're going to be screwed. We're going to be dealing with it through school year. We're going to be dealing with it through the holidays. We're going to deal with it from the time flu season starts in October or November, clear through this time again next year. So we're likely to have a good shutdown for 6 or 7 months because we did such a good job of avoiding it for 6 weeks or a month. So opening up, whether it be slowly or whatever, it's already been slowly. Gosh, it took 12 days just to be able to get a kayak out on the lake and to get somebody out on a golf course. So we probably couldn't move much slower. But we can, I know that we're going to be doing that, but I think we need to get things moving, as quickly as possible. This government goodwill of paying people to stay home is only going to go so far. They're not going to be able to afford that in the next cycle. When we get ready to do this again, because we were so careful in the spring, we get ready to do this again in the fall and next winter. Just how much goodwill is the government going to be able to offer to those people to stay home and get paid to stay home, just like the county did? The county's not going to be able to do this for 6 months next time around, but it's going to be expected because we did it this time. So, I want to talk about that, opening up for the purposes of maybe getting through this virus rather than delaying it until it's going to be really bad. Getting this lake open. I know there's a lot of debate. I have a lot of respect and faith in our own legal counsel, but as she'll admit, that there's a lot of debate over whether or not closing of the lake completely is something that we can do or could do. And now that it's open to kayaks, I'm not sure that we can keep it closed to just kayaks. Some things just don't make sense, not letting people fish. Let them fish on the lake. People are going to come up here now. They're coming up here. We've got people that are renting these Airbnbs, not as Airbnb anymore. They're renting them off of Craigslist. So people are already coming up here. They're already doing these things, but we're not realizing any benefit from it because we decided we would put these restrictions in place that are symbolic, and we ended up screwing ourselves because that's what we do when we have good intentions. But I think opening things up as quickly as possible instead of as slowly as possible, we can always tighten back up again. We can always do that, but we can't always bring a business back from the brink of being done. We can't. You got to let these people get back to work. We're going to be missing out on good weather. We're missing out on a lot of opportunities. People are getting accustomed now to shopping online. That's not going to go away. We're going to have a lot of businesses lose just because people are so used to shopping online now. I think the damage that we've done and the results that we've seen from that damage is far greater than what people are going to think that has happened in terms of saving the county from all of these cases that could have or may not have ever happened. So that's just a beginning for me. And again, I'll say it before Moak does. That's just my opinion.
You're muted, Moak.
Go ahead, Bruno. I apologize.
No worries. Thank you. So there's certain things that I agree with what Supervisor Brown said, and there's certain things I disagree. I think the hardest thing we will ever have to do is if we open up and then feel we need to close back down. I just think that is almost going to be impossible to go in reverse once we start opening things up. I think we need to do it carefully, methodically, and do our put in the due diligence to make sure that what we're doing is not going to show that we did the wrong thing. Going backwards, once people are able to do things again, they're not going to want to go back to being sheltered in place, and people already don't want to be sheltered in place, which is why we're having the type of discussion we're having right now. I'm all for continuing the limitations on out-of-county folks coming in. I know that it goes in reverse of what we fight for pretty much every single week that we're here, where typically we're trying our hardest to figure out how it is that we can get more people to come here. But at this moment in time, and it's not just us, it's a statewide situation, I think people understand. I think those that are coming here are just doing it because they can. Maybe they have a secondary home. And I don't know how we're going to stop it, but we can limit it by not saying it's open to everybody. And I know in the amendments that you put out, Dr. Pace, you even had in there, this is not an invitation for out-of-county folks. We are still shelter in place, which means stay at home, something along those lines. I'm totally paraphrasing, but there was a continued assertion that we are not looking to get people to come here and enjoy the new relaxed rules that we have. The governor said weeks, and this is where I will agree with Supervisor Brown that we have some extra restrictions that we've put in place. I am not going to debate or argue against those decisions that were made before. I think they were done rightfully so. We all saw what happened to our lake on the first weekend. There needed to be action taken to limit that, or else it may have continued throughout the whole thing. So now we find ourselves where we are. I would like to be able to meet the state mandate prior the governor saying we're going to relax our state rules. We have to get there. I'd like to get there sooner than later, but at the same time in a way that we also don't jeopardize the work that we've done, or else we just wasted 6 weeks for nothing, right? This is exactly what we don't want to do, is have everybody shelter in place, and then all of a sudden now we start having to deal with COVID-19 and seeing some impact to our hospitals and so on. I would like to continue the discussion, and Dr. Pace and I had this discussion privately, so this is not anything that I'm surprising him with. I think that my suggestion would be we continue to close the public ramps because we have the ability to. But if you own a house on the lake and your boat is already on the lake and you can't go on the lake, there is nothing safer than being out in a huge lake where even on a good day, there's maybe a few hundred feet between you and the next person, even on a good day. And so I think that we need to look at allowing private docks and private ramps to allow for the boats to go in. That way our locals can have access. If we start doing locals versus non-locals at our public ramps, we're going to find ourselves in a situation that we can't control. And even worse, they're already here wanting to use our public ramps. And what are we going to do then? Ask them to go back home to the county of origin, or it's already too late. The idea is to not invite them. I don't know the difference between just kayaking and fishing. I don't know how that would be that much more attractive. But again, I think that we need to look at relaxing those specific rules. I think giving access to our community through private docks and private ramps, and giving access to be able to go out there and fish. I think we need to be real with, I used to work remotely for 6 years. There is a certain level that you need to go out and talk to people, because even if you're working, there's a certain level of depression that can kick in of, I need to go interact. I need to go feel like I'm actually doing something. Now we have people sitting at home doing nothing, which is why we're relaxing the rules, so they are allowed to go out. It's a mental health thing to be able to communicate, to be able to go out, to be able to feel like you're part of the world. And I think that this is a valuable thing for us here. We have a lot of people who have gotten used to the idea of going out in the lake and fishing, and typically they've been isolating already through practice of fishing, because there's just not that many people out there on the lake. And I think that we can make that happen. And so I'm hopeful, since last Thursday was when we did our relaxation of the rules, and it takes approximately 7+ days to see COVID-19 symptoms come into play, that within, so this Thursday will be 1 week, the following week we have another opening, rather than waiting for more weeks. If it's earlier, I'm going to leave that up to you, but I want to try and see if we can get more of our locals' ability to access that. Here's another reason that I think that we need to do that. We're all receiving emails. We got some people who are scared of COVID-19, and we got some people that are scared of their finances or their liberties and freedoms being infringed on. I'm not going to deny anybody their feelings and their opinions on the situation that they're having to deal with. And the more we try and keep control, the more likely, and as we move day by day, we're going to lose control. And I think those little relaxations are going to allow reprieve for the frustration that people are building up in their minds. And again, for them, those frustrations are real. We can argue about it from our perspective, but I think for them, their frustrations are real. I did want to ask, I have a list of questions here. One is UCSF. Are we getting more testing through UCSF? I know last Tuesday, I believe it was, you were registering with them to get more testing. And also, if you can update us on the state testing. Originally, we were told that we were not on the list for the 80 new labs, and now we're being told we are on the list, but maybe not a time frame. Can you clarify some of those things?
Right. No, yeah, those are good. So the UCSF lab, we now have the ability to send things down there. They just got the specimen sampling materials to us on Friday. So we're now in the process of getting ready to start sending down there. Like I said, the main issue today, this week, is getting the providers to order the tests. So because we have the materials and we have the lab capacity, so now we just have to get the providers to order the tests. So I've been in communication with all the providers around in the last couple of days. We've been having conversations over the last week, and so I think that should start happening. That's why I was sort of putting it out there for people to, if they feel like they need to be tested, talk to your providers. If it's not really happening, let us know, and we can see if we can get into conversation. The other question is about the drive-through lab, which is being put around the state. They say they're going to put 80 of them around. This could be a real game changer for us. They've just got one in Napa, so if people want to get tested and they can get to Napa, there's a way to do it over there, and you can go on our website or on the Napa County website and get the information. You make an appointment and you go on over and you can get tested. There's one in Santa Rosa. They just put one up in Humboldt. They say they're putting it around in 80 sites around the state, mainly to try to make sure everybody has or can be within 60 minutes of a testing site. And they're trying to accommodate diversity and folks that are having trouble getting the kind of care they need. So I think Lake County qualifies. We're fighting. You're fighting. I just connected with Assemblywoman Aguiar Curry, and she says they're going to work on helping us do it. So I've been in contact with the people at the state, and we're just pushing. And it looks to me like what they've done is they put the first wave through, which is I think about 10 of them, and that's the one that got up in Humboldt. And then they say there's going to be 65 more that are going to be in. They say by middle of next week. I have not been able to get them to give me any promise that they will be coming to Lake County or not. Supposedly we're on a list through a different branch of the state, and so we're just pushing because I think that will be something that can help us quite a bit. If we get that capability, people will be able to get tested much more easily.
So what I would like, if it's possible, and I think the most obvious choice would be the chair, and if the chair wants to delegate it to someone else, but if you can keep us up to date as to who we need to talk to make sure that this happens, because it's a fight to be able to get those things. We're being constantly told that they're out there and they're available, but at the same time, we're not given enough data to say 100%. And no offense to you, Dr. Pace, but it's the same. You're giving us the same thing you're being told, which we're being told constantly 1 to 2 weeks we're going to have extra testing, but here we are, we're still having the difficulty with testing, and it's what you're told that you're telling us. So again, it's nothing against you. It's just the messaging keeps the same. And I'm not seeing a difference that makes me feel good about where we need to be. And if this is going to be that important for the ability to open up further, especially further than the state has right now, when the state says open up, we need to fight tooth and nail to make sure we have what we need. So please keep Supervisor Simon appraised of what's going on so that we can make sure that we do the right phone calls and the right messages to the right people for that. Also, wondering if you can provide an update on the work group that you have on Friday, and if there's maybe a timeline being worked on, because I know that right now it's kind of a vague, there's going to be a review of the amended order, shelter in place order in the next couple of weeks or the next few weeks, and wondering if there's a way that we can create a timeline, because I feel good looking at a timeline saying, okay, this might happen within this time frame versus I have no idea what might happen in the next time frame because there's no details. Wondering if that's a part of the discussion, or if you can update us on what the discussion is that's happening on those Fridays.
So, of course, the timeline would be really satisfying to be able to roll out and to be able to monitor progress and everything else. It's so let's see, the work group meets every Friday. We've met twice now. It's basically some of the county and city folks that are in the process of making these kinds of enforcement decisions and things like that. So ultimately the jurisdiction is mine because it's a public health emergency. So the order, it comes from me. I take full responsibility for it, and it's so the applause and the negative side comes to me. And the work group is a way where I'm trying to have conversations with the leaders and the people that are in enforcement roles so that we can talk about this and set things up in a reasonable way that makes sense for the county. I'm new to this area, and so trying to get the people who are well grounded in the community to help to kind of together try to make reasonable decisions about how to do this safely, but in a reasonable fashion. So I think really where we're at right now is in terms of a timeline. The order expires next Monday. I plan to extend it for 2 weeks, probably with minimal changes. We'll talk about some of the lake things. I think, my reading of it, and I'm open to being corrected about this, but my reading of it is the only real ways that we're more restrictive than the governor now is with some of the lake activities and some of the vacation rentals. Those are the two main things. And both of those are really unique to Lake County in terms of trying to slow the influx of people coming up from the Bay Area to the county. We're a highly infected area to a lower infected area, is trying to slow that influx in. That's the point of that. So if there are, and none of the ways that are currently in the local health order versus the state one are particularly business related. So, it's not like I'm restricting certain businesses that the governor says are okay, except for the lodging industry, really. So just to go through the timeline is May 3rd. This order expires. I need to do something to extend it. I plan to do it for 2 more weeks. During that 2 weeks, we'll be able to see what happens with the surge in cases. We'll see what the governor chooses to do. We'll see what the Bay Area and the other surrounding counties are doing. And we'll also, during that time, my understanding is that some of the other lake resource areas, Lake Berryessa and some of the other ones, will probably come up with what their plans are, when they're thinking about opening up some. So what I'm interested in doing, and what it seems like my understanding of what this working group is talking about, is how to coordinate all that together and how to work through efficiently. The business part of it, I think Supervisor Brown's ideas are great. When I'd reached out to the Chamber of Commerce and to try to have some conversation, and Supervisor Crandall is bringing some of that information into this work group meeting. But I think it's also a great point of contact to be in there, because we really want to be working with the business folks. So the idea is that people will start thinking through reasonable plans and submitting them to us, and then we can kind of bring all that together and talk about it in this work group, so that as the governor loosens up, we'll be ready to try to make moves in a way that makes sense. So I don't know if that's specific enough for you, but it's probably about as good as I can get.
No, that works for now. Thank you very much for that. I did want to ask you, you've spoken today, and I've heard you in this past week speaking in almost in an affirmative voice on the letter that was sent last Tuesday. And so I wanted to talk about the letter that we sent to Governor Newsom. And I guess my question is for the board, as well as to you, Dr. Pace. What's next? Because the next day we heard him in a conference say, no tweet, no letter, no nothing is going to change the course of what we need to do. I am not happy with that result, because we talked about yesterday, you and I, Dr. Pace, about the population density. LA's population density is over 2,000 people per square mile. We're 48 people per square mile. We are vastly different in our ability to continue social distancing and our ability to contain the issue that we're very aware of now, and that we are looking to follow science, and we are looking to follow guidelines to ensure the continued safety of our area. But a statewide mandate just doesn't seem like it would be an easy fit for us to be able to make things happen. So I'm looking, I know that Supervisor Simon also talked to Mayor Kramer from the city of Clear Lake yesterday, and I received a copy of a letter that has 6 counties that have signed on to that letter. That letter seems very similar to the one that we wrote. I'm just kind of asking the board, what do we do next? Because I think we need to continue to apply pressure to have local control when it's safe to go ahead and continue and move on. And I think we're getting to that point real quick. Even Governor Newsom said weeks, not months. So he's starting to kind of get more towards a more soon in the future situation. But I know that we did not have the city of Lakeport or the city of Clear Lake that signed on to our letter, nor did we have Dr. Pace sign on to our letter. I'm wondering if that's a discussion that we would like to have. Because it made me happy to hear Dr. Pace speaking in the same way that we were speaking. We don't want to do something that's outrageous. We don't want to do something that's going to be hazardous to people's health, but we would like to be able to control what it looks like when we reopen, because we do feel, and we are different than many other large population areas in the state of California, and we don't want to have to abide by rules that mainly are applied because of larger population densities. If that's the case, we don't know what that will look like. So just want to put it out there about what do we do next with that letter that we sent. And I don't believe we sent that letter to our state representatives either. So I am done at the moment. Thank you very much for the time.
Which letter, Bruno?
The letter to Governor Newsom about giving us local authority on reopening.
Okay, I wasn't sure which letter because we've sent a few of them. So
Yeah, and if I could jump in there and tell you, I did send that letter to the chiefs of staff for Senator McGuire and Cecilia Aguilar Curry. Absolutely.
Okay. Thank you.
Supervisor Scott?
Well, I think the other two supervisors have answered most of my questions. I think it'd be fair to say that none of us want to be in this lockdown position, but we also don't want to jeopardize all the great work that has been done. I'm glad to hear that you're working with our neighboring counties that also have lakes, trying to determine what they're doing to make sure that we're in the same step with them. Have they given any sort of idea of what their next step looks like with the opening of their lakes?
We had a meeting last week with Scott De Leon and Angela and some other folks there where we were talking about some of this. Angela seems to be in conversation with the other folks around. My sense is that they were talking about mid-May that they were going to be considering opening, but it wasn't exactly clear how they were going to be opening. And so I think that was the first time we'd really met. She was going to go back and talk to them again. So I think it's just going to be an ongoing conversation at this point and my sense of it after that discussion was it probably made sense for us not to get in front of the other folks because then everybody was going to come in here. So to try to kind of coordinate a little bit was probably what made the most sense just for safety purposes.
Yeah, I agree with that thinking that if we were to be the first to open, I think it would be wouldn't be so good. I think we'd have more people here than we would want. But on that same note, I think if we're asking the governor for local control, we need to be stepping that same direction, having the same things in place that the state has. That's it for me.
Thank you, Supervisor Crandall?
Yes, I just wanted to touch on a couple things. One being the testing situation. I just wanted to kind of elaborate on that. I talked to the local Lake County Tribal Health, and I remember you mentioned it last week, Dr. Pace, that they had an Abbott machine, and we're hoping that, of course, the other medical facilities can get something along those lines as well. But they only test a limited amount of tests, and so you have to have conditions, symptoms, things like that to be able to get the testing, and they wouldn't be able to replenish it. And so I'm thinking that with the other entities as well. So let's say that Sutter was able to get one, or Advantage Health was able to get one. It would be the same situation. So I think I like that Bruno had brought up what could we do or who could we contact to get some more testing in the area or something along those lines. And I'd be glad to be part of that initiative, Bruno, with you on that, and just try to talk to different officials or whoever the case may be to get that testing, because that's a key emphasis for me into getting these businesses going, and they're already doing their due diligence. They put together lists way back, about a month ago. They've already had a lot of protocols in place, so maybe they can fine tune those. You'll be at that meeting Friday, and that's good. I think I'm really glad that you're able to make that connection with them, and so that's going to be a help. I have also forwarded you some information from different folks that work on the lake and do things on the lake when it comes to fishing and tours and boats. And so you have that information. We discussed that Friday as well. And so I like that what you had stated about the ramps being closed, and what Bruno had stated about discussing folks that have capability from their homes or whatever the case may be. I think that's something for the sheriff too, in his mindset as to what they can patrol or if they're capable or something like that. But I don't see that too far out of the question as well. And so again, I want to thank you, but I am glad you're willing to work with us on a lot of these things, because our community, of course, is concerned about, they're different issues. And so There's like you said, safety, economy, and then there's rights. And so I think those are the big three issues, and I think we're touching on those, doing our best to try to make sure everyone has a concerted effort into getting everyone on the same page with this. So that's really all I have on that.
Thank you, Supervisor Crandall. Yeah, Dr. Pace, I want to thank you for the hard work. Everybody, Denise, everybody in public health, everyone's working on this issue as we go through this pandemic. Working through the process, just like every one of the other board members, I'm getting, good reviews, obviously, just like you, Dr. Pace, saying we're doing the right thing, we're moving in the right direction, and also other folks that want to open the things up. So I know it's a balancing act that we're all going through. Appreciate everybody being amenable to listen and to understand what the needs are, both of the business owners and also, our elderly groups that we have here in the county and our vulnerable populations. Each week, I know it changes, it evolves. I was happy to hear the governor say a few weeks. That gets us closer to the point of where we're going. Kind of expected the response that we got on any letter and everything. No letter ever is determined. No is never a final answer. We'll continue to push for the testing. We'll continue to push for local control at all times. If there's someone that needs to be called, you've heard multiple board members say, hey, we'll reach out to them. Senator McGuire, Assemblymember Curry are always available. Congressman Thompson has already had, a couple of town halls relating to Lake County and its residents and its district. So I know people are engaged, and it's going to be a challenge to work through this. The governor's made it very clear. There are clear benchmarks that he has set that he wants to meet, and testing being number one of those. And we just need to work through the process. I want to thank Dr. Pace for talking about, I've been talking about it from the beginning, masking. Masking is one of the main things that we get from grocery store owners, grocery store workers, essential workers. That is going to be very interesting as we move through the process to loosen up our our restrictions at this point. I think it's a key component if we're going to open it up. The other thing is, I live on the South County here, right on Highway 29, just about a mile from the Napa County line. And boy, the traffic is increasing from the Bay Area. You can see it. It'll start Friday night. It'll leave Sunday night. I've seen boats coming up here with motors on them. I've had, residents in locally here in Hidden Valley and other places that say folks from San Francisco are coming up. They're really ignoring the orders. The motorcycle groups just this weekend that we saw through Lake County, and they don't go all through Lake County. They come up over 29, they go down through Butts Canyon, but they stop right here in Middletown on the south side of the county, in groups of 15 to 20, if not even more, all weekend. So protecting our residents and our businesses always is number one. And I think one thing we need to always be taken into consideration is exactly what was talked about. We open up, we know we're going to be inundated, both at the lake and other places. And when we do those things, we are putting our local residents in, a very, very dangerous position as far as I'm concerned. But ultimately, I'm not a doctor. We'll follow the science to support everybody that we need. These are not easy times. I know right now, just on what I'm saying, I will probably get kickback, but ultimately from day one, my concern always is the health and safety of our community, our family, and our friends. And I just want to thank everyone for working through this process. Also, bring the information on the other side. I'm a business owner. We just celebrated our 25th anniversary, multiple businesses. So understand the hurt and the pain of our employees. And can't wait to get back to normal, but it seems like it's going to be a long time until that happens. Bruno, I'm right in line with you of being able to open up and then pull back. That is going to be almost impossible, I believe. But it may be mandatory, and at that time it could be a lot more restrictive and a lot more violations and other things could be handed out. So not everyone's going to be happy as we move through this process, but we just need to remember that it's affecting each and every one of us. And if it open up and we get a surge here in Lake County, it could touch each and every one of our families or friends through this process. And we hope that what we're doing now will help us avoid that. And we'll continue along this line to listen, to be open to suggestions, even when it's adverse opinions on what should be done. So those are my things that I have, Dr. Pace. I don't think there's much more to answer. Our board did a great job of asking questions, giving point of views, and I respect each and every one of them in that manner. And I know we have a lot of folks that want to speak, so we'll go ahead and go back to the board members and move through the process here before I open it up to public input. Supervisor Brown.
So maybe someone can explain to me the difficulty of closing back up if we need to. We've done it in evacuations. We do it, you know, where people actually have to pack up and move. We've done it. Here, we're just saying, go back to your house, stay there, wait again. So, I mean, I get why people would be reluctant to do it, but they're already reluctant now. So just imposing another shelter in place, it's just, it happened overnight last time. I don't think it's that big of a deal if we really need to do it. I think there's an exaggeration of the possibility going on there.
Well, appreciate your opinion. I guess I can clarify, and I thought I did, but you know, I think it would come with more enforcement than we're doing right now. Now we're asking them to do a kind of a social contract, and I believe, and that's my opinion.
Okay, yeah, there's, the enforcement is subjective to begin with, so it's not even, it's just a formality, just a rubber stamp. That's all it is.
Supervisor Scott?
I think we've also seen that reluctance when we have fires and we ask people to evacuate. Every time we ask them to do that, we're seeing less and less people leave. So we've already kind of seen that with our evacuation people saying, I'm not going to leave next time. So I think there is a concern there. It will be hard for people to go back after we give them a little bit of freedom. And I think staying the course of what we're doing, I think it's the right thing to do.
When people feel deceived, they're reluctant to be deceived again. That's how that's working.
Supervisor Sabatier.
And I think that we need to remember that there is still a large portion of our community that's very concerned about COVID-19, and just because we release and relax some of these rules doesn't mean that those people are going to go out kayaking or go fishing or go do what they normally would do in the past. They're going to want to remain safe and feel safe and possibly still remain at home. So there's going to be, just because we're relaxing the rules doesn't mean everybody all of a sudden is going to start following those rules. They're going to decide what their comfort level is of going out in the public and doing things. And so I think that we're going to see a very slow opening. We're doing the slow opening, but then there's going to be a slow participation from the public that wants to do those things. Not everybody is chomping at the bit to go out in the lake. There are some, but there's some that are still going to want to remain at home and not go to the public docks or things like that, because that's not what their comfort level is. So I think that we need to recognize that opening doesn't mean a full door wide open, because there is still a very real concern in our community for COVID-19.
That's called personal responsibility. That's what we should support.
Okay. I think the board members want to thank you, Dr. Pace, but I'm going to go ahead and open this thing, Supervisor Crandall.
Yeah, I was just going to mention too that, yeah, I do. And this is kind of outside the scope of what we've been talking about, but it is involved with COVID-19 because of the criminal activity that's been taking place. I just wanted to commend the sheriff's department. I seen them Friday actually tracking some people down. I didn't know exactly that's what they're doing, but I've seen it as a result of it on the news. And they've arrested people that were actually breaking into homes. And so that helps deter some of that mindset that, because of this situation, it's a kind of a free-for-all, because people get that impression. So I just, that was really promising for me to see that they took care of business and got those people that had committed crimes. There's been a lot that's been going on, I know, especially in the North Shore and around the lake. And so I just want to say that they did a good job in that. I know it normally this happens, but especially even more so during this COVID-19 epidemic.
Thank you, Supervisor Crandall. And that is something I also witnessed our deputies and other folks out there doing everything that they can right now with how their hands are tied. But yeah, I want to thank the Sheriff's Department, Sheriff Martin, and everybody, that's out there on these front lines in these trying conditions. Okay, I think what we're going to do is we're going to go ahead and open this up for public comment. I think we'll go ahead and start with Carol. Do we have any, at this time, any email comments or anything from yours? And then I'll go to Jake right after.
Okay. Yes, Mr. Chair, we have quite a lot of public comment. And so I have grouped it into categories. And the categories are well-being of residents, economic development, which is the business side of things, the county workforce, public safety and the shelter-in-place order, and then the lake, Clear Lake. And so you had wanted me to time people comment in lifetime. Do you wish me to time my own reading of these, or some of them are kind of long?
Yeah, the public comment today, because I know we do have a lot. We have a lot of folks that want to get in there. We're going to have a discussion, I guess. But my recommendation today as the board chair would be to limit the comments to 2 minutes so we can get as many folks in as possible through the process. I know I've attended other meetings that we've done this in workshops and other things, just attempting to get as many voices heard as possible. So yeah, if we could do the 2 minutes for public comment, I'd greatly appreciate that.
Okay, then I will time myself as well, Mr. Chair, and I'll start with the comments that I have categorized as well-being of residents. And if it works for you, I could read all of those that are kind of in that sector, and then you could decide how you want them responded to, okay?
Okay.
So the first one comes to you from Chris Macedo. He says, "Dear board, I've been watching the meeting and I'm concerned with I guess this actually was the last meeting, but it's still relevant to today. I'm concerned with Dr. Pace's comments about letting the virus impact the majority of the county in a controlled manner. I have a son that has a medical condition that would be affected by coronavirus. This obviously would not be beneficial for him to contract the virus. This would cause him to have to shelter in place until such time as there is a vaccine. I have not seen White House coronavirus task force members, Dr. Fauci or Dr. Birx, come out and say this would be beneficial. Respectfully, Chris Macedo." And then the next one on well-being of residents comes from Alicia Adams, and she says, "I would urge our Board of Supervisors to be cautious when making decisions on loosening restrictions. I have not heard anyone discuss the fact that Lake County has a senior citizen population at just over 22%, while the state average is just over 14%. The CDC lists people that are 65 and over as a higher risk for complications from COVID-19. When the board speaks of reopening the economy in a way that makes sense for the county, I do hope they take our senior population into consideration." So, Mr. Chair, those are the two that I would categorize as well-being of residents, and I'll pause for your direction before I continue with the next group.
Okay. I think on that public comment, go ahead, Dr. Pace.
Well, I think those are both excellent points. So the way we're sort of framing this is that we're trying to protect the vulnerable population, which both of those comments were reflecting, and also try to keep the hospitals from getting overwhelmed with a surge. The protecting of the vulnerable population. So basically what's happened here is we've shut down all of society. And part of the reason is we really didn't know what was going to happen. There were a lot of projections that it was going to get pretty overwhelming and that we didn't really know what was going to work and what wasn't. So everything just got shut down. Now the idea is we're trying to back off from some of that, but still we're going to need to do whatever we can to protect the seniors and the folks with immune compromise and the folks with underlying medical conditions, as was mentioned in both of those. And so that's going to be probably some dance of backing off of the whole society restrictions, but keeping folks the folks in these groups safe, and that's where the masks come in. So one of the things is as people start getting out and about more, we're going to want everybody to wear masks so that the folks that are a little more vulnerable have less risk of getting exposed. But also, you know, almost for sure, the seniors and the folks with underlying medical conditions are not going to be able to get involved as quickly and in the same way as the rest of the population, because the virus is out there. And so it's, you know, so that, but those are excellent points to keep reminding us about, is folks that are in these vulnerable groups need to take particular caution. So.
Dr. Pace, I had a follow-up. I had an email from an individual in my district asking about grocery stores and following that up, because what I've noticed is there's been a lot of advertising to seniors for senior shopping hours. And what's the balance of making sure that the stores they're going in, the grocery stores that are deemed essential, are masked, and especially in those times when they're advertising senior hours? Is that something that has been looked at by you or Denise or anybody in environmental health on how we address that? Just a question.
Right. No, that's a good question, and it's one that comes up a lot. I mean, personally, I think the senior hours is probably not the greatest idea. I think people that are seniors, people that are in vulnerable groups should stay home, and somebody else should do the shopping for them. There are some groups through the senior centers and other agencies around the area that will help people get food and help people get their needs taken care of. So if you don't have family that can do that, I would reach out to your local senior center and see if they know of a way to do it. If that doesn't work, you can contact the health department. But I think the safest thing is for people that are in the higher risk groups to stay home and to isolate. And that's probably going to be that way for quite a while. I think the other question of this, which is the masking question, we are, the stores should be, the people that work in the stores should be wearing masks. Environmental health is going out and talking with them about that. We, you know, enforcement with any of these things, as Supervisor Brown's pointing out. We have to be willing to go in and do consequences for people to really do that. I think, so, you know, it's the environmental people are going out and talking to the stores when we hear that they're not using masks, and we're having discussions with them. I'm not aware of, I heard about one store that was potentially, they were talking to them about a problem, and but they turned it around with an ongoing discussion. So,
Bless you.
Yeah.
All right. Thank you, Dr. Pace. All right, Carol.
Yes, Mr. Chair, I'm just getting word that we may have a Granicus issue. Carolyn, are you getting any word that Granicus may have gone down on us?
I'm not seeing that. Let me look back on my other screen.
It's still going on my end.
No, everything's still going on my end.
Okay, thank you for checking that.
Mm-hmm.
So, Mr. Chair, I'm going to move into the comments that I categorized as business or economic development. And the first one of those comes to you from Howard Holtz of Lakeport. He says, I commend Gary Pace and our Board of Supervisors for doing their excellent work in running this county, especially during the coronavirus problem. However, due to several experiences I've already had, I strongly recommend that you make it a requirement for all businesses, wherever feasible, to put signage on their entrances requiring all persons entering to social distance and to wear face coverings when approaching another person within 10 feet. This should apply to all employees also. And I would like to request the police to visit businesses as possible to enforce the above. We have far too many citizens that simply do not understand the gravity of the situation, and they freely jeopardize the health of our community at large and also the future success of our county opening. The next one that I classified as business comes to you from Eric Lee. And he says, construction restrictions. I thought I read that our construction sites are closed locally until the health department goes and looks at them. This seems detrimental to our local small construction companies, but if this is the case. It is my understanding that our health department is small and would only be looking at a couple of sites a day whenever they do start. If this is true, it needs to be revisited. I'm certain that many of these sites are families' homes who are having to pay rent or worse, live in uncomfortable living situations until their home is done. And Mr. Chair, the last one that I have classified as business comes to you from Mike Raffinelli, who lives in Lower Lake, Jefferson. He says, I would just like to say that Lake County has no active cases of the virus. The 6 people who picked it up from the Bay Area. I thank you for keeping the virus out. Please reward us by letting small businesses open. I have seen 75% of the people not wearing masks, but we do keep our distance. Thank you for opening the lake, but do not understand why no motors. You can get farther away from people. We have all observed the quarantine for 6 weeks. I really do not care what the governor says. He knows nothing of how we live in the rural area. We Jeffersonians want to get back to normal. Please tell our governor we will reopen Lake County without his blessing. I will never shop at Walmart and want to buy from local mom and pop stores. And those are the ones I classified as business, Mr. Chair, so I'll pause for your direction.
Thank you. Go ahead, Dr. Pace.
Well, the one that I feel like I didn't really address before was about construction. So construction's allowed as an essential activity if the project was approved or started before the shelter-in-place order. So we're not approving new work, but anything that was started or approved before can continue. And if there's a particular question that person has about that, they can, like if there's a particular instance or a concern, they can write to the email that we have on the website or call. We have people that are answering these kind of questions all day long. So thanks.
Supervisor Sabatier.
Yeah, I wanted to ask Dr. Pace, from my recollection of the essential workforce list from the state of California, did they specifically say new construction not allowed, or is that a Lake County restriction? I don't remember seeing a specific restriction other than allowing construction workers to continue.
I'm not exactly sure. I think it's been, this has been a point of conflict, and the different counties are kind of doing it different ways. We actually were, I think initially they shut down almost all construction, and then they were sort of vacillating a little bit, but because of our needs, because of the fires and the need for housing, we were trying to push it open a little bit more. So yeah, that's a good question. We can check on about new construction, because I mean, housing is a huge need, and we're sort of like we're sort of preparing for the COVID while we're trying to prepare for the fire season and recover from the previous fire season. So all these things are kind of working at the same time. So I'll check on that.
Yeah, because I would like to think that right now our planning department is still working on approving and going through projects. And if projects are approved, any kind of delay to start that construction is a extra added burden on those. They're not going to make money right away. They just need to get started on building something. And it's just strange to me that one set of workers, it's okay for you to work, but another set of workers, it's not okay for you to work. And I just like to have that reviewed.
Great.
Okay, Mr. Chair, if you'd like me to keep going, I'll move into and again, I was trying to align these comments with the priorities of your board. And so the next set is Clear Lake, concerns of Clear Lake.
Yep.
These came from the same submitter within about 10 minutes of each other. And the submitter is Leroy Dubral. And he says, why can't we have local fishermen with the quagga mussel stickers on their boats, practice social distancing, and fish on the lake. They can also issue stickers to kayaks and canoes and require them for being on the lake. If we have the information on the individual stickers for these watercraft, they will know if they're local people, if they are local people, or if they are out of towners. Also, revenue will be gained by this for the county. If the sheriffs enforce the quadrant muscle sticker and issue violations to those not having those, would solve the problem. And then the second part from Mr. Dubral, if the sheriff enforces the quadrant muscle stickers, it's easy to tell who is a resident and not a resident because of the color of the stickers. If only local boats are allowed, these stickers can be viewed from a distance away, either on the trailers of the boats or on the boats themselves, to determine if the individual is a local resident or a person from another area, which may be from an infected area. Also, if the fines are levied against the individual who disregards the rules and puts his boat on the lake without permission, once the word gets out about the amount of fines itself, will keep more people from coming to this lake. Supposedly, this obeying the rules, I think maybe he means disobeying the rules, is a misdemeanor. So those are the comments on Clear Lake this week.
Okay. Dr. Pace, I don't know if you want to try and take a piece of that, and then I don't know if Sheriff Martin would address any of the enforcement issue questions, but thank you, Carol.
Okay, so would you like me to move on to the next category?
No, I'd like Dr. Pace and
Okay, thank you.
whoever else would like to weigh in the room on it.
Sure. I think two things. One is I think those are exactly the kind of thoughts we need in terms of moving ahead. So probably the next step is going to be some version of what you're mentioning in those notes there of the next level of opening up. So again, we'll open up this little bit, see how it goes, and then we'll take the next steps. And so that's what these planning processes are, is trying to set out the next couple steps. My understanding is we have to be really careful about saying out of area people can't come in. We can sort of encourage people to stay home, but there's constitutional issues around preventing people from coming in from out of the area and basically just on their zip code. So what we're trying to do is kind of allow activity, do it by activity. So certain activities can be allowed, but everybody can participate in that activity, as opposed to like certain activities are allowed, but if you're from this zip code, you can participate. If you're from that zip code, you can't. So that's kind of, from a legal point of view, the way we're trying to proceed. It's a little bit problematic for the local folks because, you know, you want to be able to enjoy your backyard and the things that you are familiar with and have taken care of and are stewards of, really. But from a constitutional point of view, my understanding is that we can't say, if you're from San Francisco, you can't use the lake. That's not, so it looks like Anita might have something to say too, which is great.
Mr. Chair, if I may?
Yes, go ahead, Anita.
Certainly, when you're talking about the use of the lake, you're talking about the types of activities. And obviously, also, you're talking about certain temporary measures designed to protect the public from the disease that's known as COVID-19. So when you're talking about just simply saying, well, who can have access in terms of characterizing people, that's more problematic. However, it is also true that an influx of tourism is going to impact what are relatively sparse resources in a rural county. You can also harken back to the governor's orders that limit essential travel and deal with it that way. So there are ways to go about this that either are implementing the governor's order or are limiting it to types of activities on the lake that don't say you're fine, Joe Blow, John Smith, you're not. And I'm happy to, as we go forward on this in terms of opening up the lake, there are narratives that can be applied here that will help the public understand, it will support the public health orders, and it will be consistent with the executive orders of the governor.
Okay, thank you, Anita. I see Sheriff Martin.
Hi, thank you. Yeah, just thank you, Anita Grant, for the words of wisdom. That's amazing. She's taken up a whole bunch of what I was going to allude to, but also, in particular, the limited resources. We don't all of a sudden have a whole bunch of cops that are available to enforce these types of things. Over the weekend, we were able to deploy one boat patrol deputy each day for basically 8 hours a day, and we still continue to have those calls come in. The other problems that we look at running into are the issuing of these stickers for the local residents only stickers. I can guarantee you that we're going to have an influx of calls that these stickers are being stolen, and then which boats are actual residents or which ones have stolen stickers. And I don't have the resources to do that. If we're going to open it up, let's open it up. If we're not, we're not. So that's all I ask for. And I appreciate the suggestion, and believe me, I want to get the lake opened up as soon as everybody, but also keep in mind that we need to keep things safe. Thank you.
Thank you, Sheriff. Scott DeLeon, Community Development. Go ahead, Scott.
Yes, good morning. You know, the Quagga Missile program is, you know, it relies on extra help. You know, it's good for monitoring the public boat ramps, which are currently closed. We have no control over private ramps, and we're going to really struggle trying to keep folks from coming up here and either completely disobeying or disregarding the sticker program, or, as Sheriff Martin said, relying on other methods and other means of getting their boats out on the water. I too want the lake open. I'm happy to do whatever the board directs. I'm just going to respectfully ask that a lot of thought be put into how we're going to do this. I can see perhaps an emergency ordinance, or at least the modification of the current Quagga Mussel ordinance. You're going to want to make the fines significantly stiffer for violation of this, and we're going to need to modify that ordinance. So it's not something that we're just going to open the lake. It's going to need some real thought and some real planning, and I'm again happy to participate in that.
Thank you, Scott. Okay, Carol, I think we can continue at this point. Do we have any more public comment from you, Carol?
Yes, there's quite a bit more. The next category I categorized as public safety. These are comments regarding the shelter-in-place order. And as you're seeing, you know, so much of this is interrelated. It's difficult to categorize it, but so thanks for bearing with me as I've attempted to do so. So this next comment comes from Stephanie J. Vandegrift. And what Stephanie has done is provided a copy of an article about how Sweden handled the epidemic. And she cites that Sweden is an example of a country that refused to lock down for coronavirus, and they have seen good results. Sweden's top epidemiologist believes that his country could reach herd immunity for COVID-19 in the population there by May. According to modelers there, they are starting to see so many immune people in the population in Stockholm that it is starting to have an effect. Her point being, quarantine the sick, not the healthy. So that is the first one I would say is about the shelter-in-place order. The next one comes from K. Scott Wires, who is the owner-broker of Proprius Real Estate Services. And it says, enough is enough. It is time to open the county. After all the shutdowns in the past few years, it is time to take bold steps and reopen the county. In addition, I'm demanding that Dr. Pace be relieved of his duties to control the situation. I do not believe he is qualified to make these types of recommendations. He is a general practitioner who needs to go back to Healdsburg. He has only been involved with Lake County for a few months and has very little, if any, personal experience of the shutdown history in Lake County over the last few years. For a doctor, he has a very bad bedside manner when it comes to the mental and economic health of this county, despite some background in psychology. The citizens of Lake County need to be treated with compassion and understanding, not with continued threats and bullying. Let the citizens of Lake County get back to work and play. Really? No fishing or boating in an area with a large lake? Open the county and send Dr. Pace home. And the last one on public safety, the shelter.
Can I interrupt on that
Go
one?
ahead, Bruno.
I can't let that one slide through. I don't think there's any public health officer that has the level of experience that we need, because we've never experienced this. It's been over 100 years since we've had an epidemic or a pandemic of this level, and there are no public health officers with an experience. We're all learning as we go. We're all doing the best that we can with the knowledge that we have. And Sweden has a 12% death rate right now, so I'm not quite sure how they're doing great. We're at 0 right now. So in Lake County, that is. So I can't let that letter go after the attack on Dr. Pace. Do I disagree with some of the things that Dr. Pace is ordering? Yes, I've talked to him, but we disagree in a cordial way. And I think he's making the decisions he's making best due to the best data he's able to acquire and making those decisions. We should be allowed to disagree and have those conversations, but that kind of, I couldn't let that one slide without having to say something. It's too far.
Thank you, Supervisor. Yeah. Which I'm in agreement also, and most likely the board will be too. So I know we get these both sides. We're gonna have people agree with us and disagree. And we appreciate the public comment. And Carol, I think at the beginning, all of these public comment will be part of the public record as we move forward if we don't get to all of them, correct?
You bet. And I'm pretty close to being done.
Okay.
Me to continue. So the next one, again, I classified this as public safety regarding the shelter in place order. Thank you for keeping us, this says, Dear Board and Dr. Pace, thank you for keeping us safe in Lake County. I noticed that the number of tests is very low. How much testing do we actually need to know we are safe to open up here? And that comes to you from Dan Mitchell of Kelseyville.
Dr. Pace, I think you're still on mute.
Hi, yeah, thanks. Well, the Sweden comment is, is related to this one. It's really about testing. Sweden, they've got a lot more testing and they have a more coherent care system and everything. So and we're all watching, we're all learning. Maybe in 6 months and we'll look back, we'll say, oh yeah, that was a good way to do it. And my qualifications are what they are. I can only do who I am. So it's we're all trying to do this together, and I appreciate the support of the board. The testing question is gigantic, and it's very kind of sobering for me to be. I've worked a lot in the rural areas, but I have not quite seen the disparity the way it is right now, where the urban areas are getting these drive-up testing capabilities and we can't even get swabs. So the swabs are coming in now. I think it's in the process of changing. I think this week we will see more availability. We've gotten some things. If they don't bring the drive-through testing in, we're going to set up a mobile testing unit by the end of the week through the health department. So the health department is sort of serving as a bridge for what should be happening in other ways. I think the question is about how much testing we need to be able to have in the county. I don't really have a number at this point. What I'm really interested in is everybody who has early symptoms or is at risk can get tested quickly. So that what I want to be able to do is pick up clusters quickly and then be able to isolate them. That's how we're going to be able to control the spread. I don't really think we need to get to the point where we can test the whole population, or, you know, the antibody tests are not particularly useful at this phase in the outbreak. They will be later on, but right now is if we had the ability for everybody who has some symptoms or who went down to the Bay Area and is concerned to be able to go get tested, and so we could contain things. That's really where it is. And I think we need something like, you know, we've done 400 so far, and some of those were done out of county. So we probably do 50 a week right now. And I think if we could do 3 times that a week, we'd be probably pretty good shape. And I think we're going to be able to get there pretty quickly. We're in the process of, it's moving now. So for the first time.
Thank you, Dr. Pace. Bruno, did you have a comment?
I was just crossing my fingers that will be
Oh,
the case
okay.
in a couple weeks.
Right. Excellent. Yeah. Well, we'll keep pressing. We'll keep making those phone calls and those contacts also, Dr. Pace, for you. So, all right.
Okay, Mr. Chair, then the last 2 comments are either from or regarding concerns about county employees. And the first one comes from Christina Lloyd. And
you know what, Carol, let me, Supervisor Crandall, did you have a comment?
Oh, sorry.
Yeah, sorry about that. Dr. Pace, you know, you mentioned something, and you may have already said this either last week or the week before. In regards to the folks that have already tested positive for COVID and have been isolated and all of that, without getting too far into who they are, it has nothing to do with that. But is there a capability of finding out if their immune system would be able to have those antibodies and whatnot? Are they doing anything about that, or is that too far out? I just thought of that as we were talking about this.
You asked a couple questions about testing, because you asked something earlier about the tribal health testing machine too. And so again, there's 2 types of tests. One is the PCR test, which tests the presence of the virus, and that's the one that we're trying to get the swabs and everything for. The other is the antibody test, which you're kind of referring to now, to test for immunity. The current thinking is that if people get infected, they are probably immune for some period of time. We don't know how long, and we don't really know if they're absolutely protected or not. There may be some relation between how much virus they had and how protected they are. It's still, the research has just not been done yet. So that's going to take a while to really sort all that out. If you had gotten infected, could you go work with a person in the ICU that was a COVID patient? Probably. Are you for sure protected? We're not sure. So, and the tests now, there's a wide variety of tests, some of which are pretty good, some of which are pretty bad. And so we're just trying to sort out which are the good ones and which ones aren't, and how to use those. So the answer to your question is we really don't know that much yet. And but the answer to your question you asked earlier, which was about how to use the Abbott test that they have at Tribal Health, because it has a low throughput, it's really good because you can get a result in 20 minutes or something. But what we're really trying to do is to use this UCSF testing capacity and do a lot of tests. So do 25, 30 a day and get them down to UCSF, and we can turn them around in 24, 48 hours. And that way we can do the kind of quantity that we really need to do to see what's going on in the county.
Thank you, Dr. Pace. Thank you.
Okay, Carol.
All right, Mr. Chair, last 2 from employees or regarding employee concerns. And the first one comes from Christina Lloyd, and her question is, will the essential worker leave apply to essential workers stationed at home? And Mr. Chair, if I could just respond to that one real quickly, what I would like to convey to Ms. Lloyd is that that we're still in the process of rolling out the essential worker leave. We had to complete the meet and confer process. And later today, I am having a meeting with department heads to discuss that. And so employees should await further word from their department heads. And then the last one for the email comments comes from Marilyn Taylor. And she says, as wastewater treatment plant operators and distribution collection system workers. We are now working in close contact with a medium, which is now being tested, and we are the ones pulling the samples for the presence of COVID. All 4 plants are taking samples from, all 4 plants where we are taking samples from have tested positive. Some say we are compensated by our wages for these hazards, but the county just surveyed and found out that it's all employees are grossly underpaid. Even if this were not the case, we have known effective treatments and inoculations for the stuff previously in wastewater. There's no such thing as yet for COVID, and the COVID virus is much more easily transmitted to our families. We should be getting appropriate compensation for the extra risk. Between temporary hold put on wage hikes agreed by the county and the union and the lack of hazard pay where appropriate, it will be a wonder if the water and wastewater workers for the county don't start bailing out for greener pastures, as they already were based upon the findings of the survey. So that completes the emailed public comments.
Okay. On answering, obviously I don't think that's not a question for Dr. Pace. I don't think as you move forward, that's more of the last comment there of the board. I know we're working in challenging times at this point and attempting to do everything that we can to hopefully support our essential workers and our frontline workers that are out there exposing themselves in the best way that we can. If any of the other boards have a comment on that one.
I think you said it. We're looking out for their health and safety, and it's tough times to make huge decisions, but we're trying to make the right decisions to provide that level of support. I know also from the conversation about the wastewater treatment plant and it showing positive on all 4. Dr. Pace might be able to correct me if I'm wrong, but I believe there's no evidence or any science to show that you can contract the virus through the touching of the sewer waste. I believe that's what I read in one of the things that we published. So, but I'll let Dr. Pace either correct that or say that that is the case.
Right. I think the question of infectivity of the viral particles in the sewage is, at this point, they've not been able to grow it out. So, this is one of those things where it's a very quickly evolving science. The best knowledge we have right now is it's not infectious. It's not, people should not be able to get the infection from that. But we've said that about some other things in the past that have turned out to be differently. People are wearing, people are not touching raw sewage anyhow. It's they're very protected. There's a lot of concerns about the stuff that's in the sewage. This is just one more. And so I think they should be taking proper protection, and at this point there's no evidence that anybody can get it from the sewage. But it's still, we're still learning a lot every day about this virus. So.
Right.
Thank you, Dr. Pace. Okay, Carol, do we have any other comments from you?
Those are all the email comments, Mr. Chair. I do see that we have had one comment come in via chat and several hands up from people in the room.
Yeah.
My suggestion would be that you start with the verbal comments from people in the room, and then we'll close it out with anything that's in the chat log.
Okay, as we move through this, Jake, we're going to go ahead and open up the room. And I see I have 4 little hands down here, 4 blue hands that have been raised. And if we could work through those processes, Jake, I don't know if you'll open them up from the first one to the 4th one. But Jake, if you could open it up, greatly appreciate it.
Yeah, got it. So the first hand I saw come up was from Sally Peterson. Sally, I'm going to, oh, you muted yourself right there. So go ahead and you have time to speak.
Thank you. Good morning. My comments were, I've been listening here for now 2 hours. So thank you to the Board of Supervisors and to Dr. Pace and everyone in the chat room that's listening and commenting. I just had some comments about the Bay Area announced yesterday that they were extending their shelter in place until the end of May. I'm not sure. I'm glad to hear that Dr. Pace is recommending another 2 weeks. I don't think that's enough, but I'm glad that he is recommending that. I think that if we relax too much, we do not have, in our county, we do not have the resources to handle a surge. Obviously, as Dr. Pace stated, we can't even get swabs. So I think that we as a county have done great in light of the situation. I think we've been successful because of the proactive measures that have been taken in light of the lack of testing. And I just think that if we start relaxing these restrictions, that ultimately we're going to be moved into a reactive mode. And I don't think we have the resources to be reactive. And the difference is the results are going to be deadly. The shelter in place is saving lives. And I know everybody has their opinions, but the board is entrusted with the safety of the citizens of this county. And I just have grave concerns that if we relax these restrictions, it's going to have just deadly results. So I feel for the business owners. I'm a member of this community. I'm a Middletown citizen. I'm also a citizen of Middletown Rancheria. And I serve my tribe on tribal council. And, we are impacted greatly with the close of our businesses as well.
2 minutes.
Okay, thank you.
Okay, thank you very much, Sally. Jake, can we go to, Supervisor Shropshire?
Can I respond to that? I think that it's inevitable that we have to extend the shelter in place, but that shelter in place is going to be revised and loosened up. We can't get rid of the shelter in place and loosen up. It's still a shelter in place for specific things will continue to have to be where they are, but we're going to slowly go and methodically open up certain things. So I don't see us getting rid of the shelter in place. I see us moving towards getting rid of it, and it's going to have to be extended because it's going to take time to do that incremental steps of getting to where we feel comfortable to fully open 100%. So when we say we're going to continue the shelter in place, that doesn't mean that there's not going to be amendments and restrictions being loosened as we continue the shelter in place. And maybe that's what the Bay Area is doing. They're extending it, but also looking at restrictions that might be loosened. I don't know what they're doing, but I know that I feel our intentions, and I'm kind of paraphrasing Dr. Pace's intentions, is to continue it while reviewing the loosening of restrictions.
Thank you, Bruno. I don't know if you had anything to say, Dr. Pace.
Yeah, I mean, that's absolutely right. And the way I'm thinking about this now is probably we'll just move forward in 2-week blocks. So each 2 weeks, we'll look at what's been done with the state, how the surge is going in the local area, and then either continue at the same rate like we will this time, and then potentially loosen some other facet as we go along. So it'll be like step by step, and we'll adjust it as needed. So, but I really hear your point, Sally, around it, and there's a lot of people expressing concern like that. Is certainly on my mind every day. So thank you.
Okay, thank you. Jake, go ahead and go to the second person in the room with their hand up.
I missed the order of the next hand, so it came up pretty quick. So I'm going to go down the list.
Just go down the list. That's fine.
Frank, I see your hand up next in the list here. Okay, you're unmuted.
Hi, my name is Frank Deloso, born and raised here in Lake County. Live in Lakeport. And, we have been in lockdown for weeks and weeks. And I'm a type of person, I respect law enforcement. I've never even had a speeding ticket. I can say that. But I really feel that this is going into a little overreach. I keep hearing follow the science, follow the science. But I'm seeing more and more that the science had it wrong. The models that were projected were absolutely wrong. You know, I know they were ordering FEMA trailers to come in here. I mean, my sister works at the hospital. Her hours are getting cut. We're seeing more and more of this. It's not what they told us it would be. I'm not saying it doesn't exist. I don't want it. I don't want the flu. I don't even want a cold. But there needs to be a time where you just got to look at it and go, you know what? They were wrong. Let's backstep this thing. And we're seeing more and more. A judge in Southern Illinois this week, he actually deemed the stay-at-home order was overreach from the governor. You know, we can see that that Attorney General Bill Barr, you know, orders legal action against governors who infringe on civil rights. We're seeing more of that, and you know, in order for you guys to protect us, what the government's job is to protect our rights as citizens by upholding the laws of the United States Constitution and the California Constitution. And I'm looking at it. This is beyond, you know, giving us permissions. You know, saying, okay, well, now we're going to ease up, and you can do this, and you can do that. The science had it wrong.
That's 2 minutes, Mr. Chair.
Okay.
Frank, thank you very much. I don't know if you want to talk about the science, Dr. Pace, or anything like that one specific, but Frank, thank you very much for your comments.
Well, you know, I mean, I think it's the way we look at what's happened is we were watching what was going on in other parts of the world and the country and seeing the exponential rates. We started seeing some of that going on in San Francisco. Most of the scientists now think that the reason we have a different experience in the Bay Area from New York is because the shelter-in-place orders got put in place so fast. So from the public health perspective, this is success. You know, sounds like from this gentleman's perspective, this is a sign that the models were wrong. So, you know, it's one of those things when you prevent something, you don't really know whether what you did actually prevented something or whether it wasn't going to happen anyhow. The best evidence we had at the time was that this was the best thing to do. I think the thing that we're getting more information about now that we didn't have then is the impact of density and the fact that these dense urban areas, it's much more explosive the way it goes off than in the rural areas. But even in the rural areas, you can see, like in South Dakota and Minnesota, where they have the meatpacking plants, where people are densely working together, or in the nursing homes where people are in congregate situations that it can spread really quickly. So, I mean, I think his point is well taken that it didn't happen the way we thought. We're thinking part of that is because of the efforts that were taken, and part of it's because of now that we understand better about how it spreads and the density issue. So this is part of why we're trying to get the governor to let us take a little different path forward in the rural counties than in the urban counties. But you know, I think this is one of those things where it's all new territory, and when we look back, we'll see what were the wise steps and what were the not wise steps. And people are struggling in this process now, and nobody's dying in the county from it. So we're just trying to walk that line, and all these opinions are important to weigh in the decision. So thanks.
Absolutely. Okay, Jake, go ahead and pull up the next hand.
Okay, the next comment is from Leroy Dubrall.
Go ahead, Leroy.
Leroy, I'm gonna unmute your mic here.
Yes, I'm using my mic here, right?
Okay, yes, we can hear you.
Okay, fine. I have applied for a reasonable accommodation so that I can fish on this lake after I spent a lot of money on a handicap boat and everything else. I can't stand up more than about 25 minutes, 20 minutes fishing. I cannot access the ramps because I can't carry all my tackle down to the lake. So I've requested a reasonable accommodation under ADA, American Disabilities Act of 1990. This has been going on for about 10 days now. I haven't heard any response at all from the health department regarding this issue. Also, I'm just wondering why, we're closing the lake to people that live here, because if you're out in the lake on a boat alone, how are you going to transmit any disease back to anybody else? Well, on the other hand, people coming in to fish and on the bank, the sheriff doesn't have the manpower to check and see if everybody's wearing a mask or social distancing or anything, disobeying any other rules. And that's what all I have to say. I'd like answers to that, please. Thank you.
Thank you, Brian. Go ahead, Dr. Pace.
Mr. Dubral, we are aware of your situation. I thought somebody had gotten in touch with you, but if not, we'll do it today. Yeah, we need to accommodate to ADA. Absolutely. The point of this is not to restrict you from your, that situation. So somebody will get in touch with you today.
Okay, thank you.
Thank you, Brian. Okay, do we have any more hands up at this point, Jake? I don't see any.
Yes, there's one more hand. I have a
Okay.
Brian Dabrowski.
Oh, well, sorry about that. I was calling the last guy, Brian. Okay, go ahead, Brian.
Brian, I'm going to unmute you. You are unmuted. Are you there?
Yep, I'm here. Hi, everyone. So I like some of the things that I've heard, some of my concerns that were already addressed. I would just like to add that if we do open private ramps, we should add that the business owners who operate private ramps, such as Brato's Marina, they can possibly open and allow public to use those ramps to access the lake, who may not have their own ramps at their house to be able to access the lake. Additionally, I think if we go down the route of restricting non-local in the lake, our public launch facilities to eventually accommodate those people, to prepare them for social distancing, such as drawing out lines for waiting areas. I would be more than happy for that myself. I think the rest of us also be considering here is the fact that the county needs to be considering how to adapt to this current environment. We can't sit here for 12 to 18 months waiting on a miracle cure or a vaccine to come in. How does the county plan to fulfill its budgetary promises to the county, and how do they intend to pay county workers and emergency response personnel if no one is working and paying taxes? That's after we this is for setback, evictions. These homeowners are going to be forced to keep people in their home and paying them rent.
Hey, Brian, we're having some technical difficulties. Maybe I don't know if it's on our end or your end, but
it's probably on my end. I swear to
Okay.
God, sometimes it's reliable internet in Iraq.
Yeah, well, I know we made some movement on that last week. I know in sporting, hopefully we can improve that. But if you could just slow it down, and we'll try and catch you or let you know when it's going in and out. So go ahead and keep going.
Mr. Chair, we did hit the 2-minute mark, but I know that we couldn't hear him
Okay.
time. So would you like to give him another minute or?
Yeah. Give him another minute here. So
Fair enough.
I think we heard up to the part where
what
private
was the
boat
last
ramps
part?
and other things. Okay, go ahead.
I'm thinking we should add to the order that maybe we can allow bring this to own upstream residents. I think that would be pretty reasonable, but I think that if we go that route, we should start putting plans in action at our public.
Yeah, we're having some real difficulty hearing you. I'm sorry. We're losing you. I know I'm almost positive we've received some letters and other things. Be willing to try and have an offline conversation, maybe on the phone or something. But if there's anything you want to try and wrap up here at the last minute, go ahead. I couldn't hear that. I couldn't hear
Mr.
much
Chair?
of that. Yeah.
Mr. Chair, this is Anita. The caller can also submit these comments in writing, and your board can agree to make them part of the record in this matter.
Yeah, I think at this time, obviously, it's going to be our option at this point, but you can definitely reach out to us as a board, and we'll try to respond where we can hear them. We apologize about the connectivity there and hearing most of those things. I think we heard a little bit in the beginning. Go ahead, Bruno.
Can you give me 1 minute to try and offer him a way to talk? Hey, Brian, why don't you talk through my phone and give us your last minute, because my internet's working just fine, and through your phone, we can hear you.
Oh, perfect. Okay, so what I was going to add is I think that we should allow the marina owners such as Brazos or Canacay Vista the freedom to operate as a business and allow locals to use the lake. But if we go that route, we should be taking action as far as painting lines or setting up our public launch ramps to accommodate the actual public for coming up here. Ultimately, the county needs to be considering how to adapt to the current climate. We can't sit here for 12 to 18 months waiting on America's cure. What does the county, we need to ask ourselves, how does the county plan to be fulfilling its budgetary promises, and how does the county plan on paying county workers or emergency personnel if nobody's working and paying taxes? These are very serious things, and it all comes into public safety. They're very serious questions. Another separate issue is the timeline for court hearings. They're pushed back 90 days after we do a full reopen. That's going to force homeowners to allow bad tenants to stay in their houses that they were trying to evict prior to the shutdown took place, and these people could be destroying their property. You know, I mean, these are things we need to consider.
Absolutely.
All right, thank you, Brian. We'll respond online.
Yeah.
All right, bye.
All right, thank you very much.
I just wanted to make sure that he was heard, and him and I had already communicated in the past few days. So I just wanted to make sure that he had that opportunity.
Yes, and I think we've received letters. I know that, you know, obviously what we're speaking about today, and we all have our concerns and other things, but we understand the importance of getting the economy back up and running. But it is a balancing act, and working with Dr. Pace and the health officials is something we're talking about as we move forward. So we clearly understand that issue. It's just, like I said, we're learning on the fly here, and we're doing the best that we can to move forward in that direction. And it sounds like there was some good conversation today. I know it's not quick enough for some folks, but those discussions are happening constantly, even with Dr. Pace initiating our meetings with all of our business folks and other things that are happening on Friday, a reopening or committee that's happening. So those conversations are happening as we move along through this process. And go ahead, Supervisor Srati.
And in the comments, he said 12 to 18 months, and obviously that's the timeline for a potential vaccination. I don't think any of us, including Dr. Pace, is looking at a 12 to 18 month continuation of what we have now. 12 to 18 months, will we allow for mass gatherings or things like that? That's a question that we can't answer at this moment in time. But I think that we are looking at definitely loosening those restrictions and trying to figure out how it is that we can get to some level of normalcy that we had before all of this started. I appreciate Dr. Pace saying today that every 2 weeks he wants to review and look at something. And I hope that not this Thursday, but next Thursday, that we can have some guidance on what else we might be able to do based on the results of the first loosening of the restrictions that we've seen. Luckily, it looks like the public behaved in the way that we hoped that they would. And I think it's because people are very aware of what's going on. I don't think there's anybody that's been under a rock that has no idea that COVID-19 is around and what's happening in the world. So I think we're all very aware of the new lingo, social distancing. And so I think that we all are wanting to see these things continue and not be stopped. And in order to see them continue to be loosened up, then we have to do our part and do what we're supposed to do. And I think that we're going to see that.
Okay. I know we have 3 more hands up that I can see on my screen. There's probably more, but Jake, if you can go to our next commenter in the room here.
Yes, the next hand I saw come up was from Ed. Ed, are you there? I'm gonna unmute you, Ed.
Hello.
Hello.
Yeah, this is Ed Ligon. I just want to thank the board, Dr. Pace, for allowing us to make comments at this time. I sent a letter to the board and to Dr. Pace April 9th, and basically it stated why this failure that we had was seeing so many boats come into the county. And I bullet pointed why it didn't work, because there was no restriction in place by the county at the time that everybody was coming to the lake. No ramp closures were in place. I'll make a comment on that. When we had the ramps closed the following day when Dr. Pace stated the order, there was probably 400 boats up here. When the ramps went, when they closed the ramps, we didn't see any boats on the water. It went from 400 boats to 0 in one day. So that can be still in place. The Quago mussel stickers were still being issued. And the other one was, there was no enforcement or signage on the lake, and we had a local tackle store that was still legally open, telling people it was okay to come up to the lake. He still issued Quago mussels, and I believe that all this could be rectified by following what we have in place right now. But there's no changes that need to take place. Basically, all the ramps stay closed, but I believe that we need to open up some of the ramps to allow local people access. All the local people right now, they have a red and gold sticker on their boat. The out-of-towners have a white and blue sticker. You can tell the difference between the two. It's easily visible to be seen 300 feet away. So that could stay in place where you don't issue any Quago mussels. And I also stated in the letter that only 2 people can be fishing on the boat. And that would limit the numbers to safe distancing and allow us to be back on the water. And I'm a local guide on the lake, and I've canceled all my trips, and I will abide by whatever the county decides. I'm not a renegade. I'm not going to go out there and do something that's wrong. But I would like to have you guys review that letter and see if those recommendations wouldn't work for the residents of Lake County. Thank you.
Thank you, Ed. Supervisor Scott.
I think it'd be really important to have the ability to buy those stickers if we were to open the lake. Because I know, like for myself, we don't have an updated sticker. So if we were to take our boat out, we would be illegal, even though we are a resident, not having this year's sticker. So I think that has to be in place if we were to open our lake back up.
Thank you, Tina. My question, Dr. Pace, have you seen that letter? We'll have to get that letter if it hasn't been forwarded to you directly. We'll have to, Ed, if you could resend that, we'll try and pass on the information or send it to the MOAC. Go ahead,
Right. If Ed could send that in, that'd be great. I think it's one I read a while ago when, we weren't really in this mode. Now that we're in the motion of talking about this, Scott's really helpful. He's really smart about the lake and how to do this in a reasonable way. And he came and spoke a little bit ago. And so, we are meeting as a kind of a lake advisory group with some of the constituents there. And so we'll, if you could send that letter again, that'd be great. I can probably find it, but just to make sure, send it again and we'll look at it. Those are the kind of suggestions that we want from the people that know about things, and we'll consider them and try to work with them. So thanks.
Supervisor Sabatier?
And I just got word that Kelseyville Lumber is doing the Quagga stickers, and they're an essential business. So there are some that are intertwined with the essential work list or business list that do the Quagga mussel stickers.
Okay. Okay, Jake, let's get to the next hand up.
All right, the next hand is from Jan Coppinger. Jan, I'm going to unmute you. Or no.
Okay, can you hear me?
Yes, we can hear you.
Okay, thanks. This is Jan Coppinger. I'm the administrator for special districts. And I just wanted to clarify something about the COVID-19 being detected in the sewer. Some people believe the sewer is now more dangerous than it was before, and this is simply not true. COVID-19, we're told, is easily killed with detergents, bleach, disinfection, and even hot water. By the time picking it up in the sewer, it is mixed with all of those things. Public water systems have chlorine, people's household cleaning. It is a dead virus when we pick it up. That's not to say sewer is not dangerous. It has many hazards, but I just want to clarify that it is no more dangerous now than it was before COVID-19. Yes, there's a lot of hazards in sewer. It is toxic and it is something to stay away from, but COVID-19 being present is not giving any more danger from the actual sewer itself. I just wanted to clarify that because some people are quite concerned about it and they need to know that that is a dead virus.
Okay, thank you very much. Supervisor Scott, did you have something?
Yeah, I have a question for Jan. Are we still testing for COVID, and how often are we testing our sewers for that?
We are testing. We're testing weekly, and I'm a little discouraged by how long it's taken them to get the results out. They got overwhelmed. After we joined, they had another 160 agencies jumped in, and it really bogged them down. So we should be getting some more results within maybe today or tomorrow, and they are about 3 weeks behind in getting us those results, but we are testing weekly, and they do believe they're going to get caught up soon and be able to get back on track.
Thank you.
Okay, thank you. Go ahead, Supervisor.
If there's nobody else on the, I did receive an email that I wanted to read. So when when you're done with the room, let me know.
Okay, there is. It looks like we have another hand up here. Jake, go ahead.
Yeah, we have another hand, and there's been a couple of comments shared with me in chat that I wanted to see if I could read out as well. But before we move on to that, Frank has his hand up. Frank, would you like to speak?
Yeah, this is Frank Deloso again. I hope it's all right. Is it all right to do a second time?
You know, yeah, we're trying to get to everybody on the list, but Frank, if you keep it short, that'd be great.
I'll do about 30 seconds. I just, I appreciate all you guys for everything you guys do, but I'm just very discouraged when I see the goalposts going out farther and farther. We say we have nothing going on here in the county because of social distancing. We don't really know that because we don't have a control group. Just we need to open up our county. So for business and the lake, people are suffering, and I'll leave it at that. Thank you very much.
Thank you. Okay, I don't. Frank seems, there you go. It looks like all the hands are down at this point. Bruno, I'm going to check the room and then I'll bring it back to you, okay? If there's anyone else in the room at this point that would like to make comment, Jake, if you could unmute it, go ahead and we'll go from there.
So I had some comments that were shared with me. Did you want me to do anything with those? They were sent through the Zoom chat.
Okay, I didn't know. Yeah, how many do you got?
I have two. One was
Okay.
sent from Steven here. I don't know if he wanted the floor to share his comment himself. He had not raised his hand. I didn't know if that was just not able to find that option or not, but he's still here. Well, anyway, Steven had written into chat and he said there are at least 4 lakes within 2 to 3 hours open. Your Lake County residents are going there and then coming back here. Is that safe? I believe opening our lake would stop that.
Well, I think we have a shelter-in-place order, and they're violating the shelter-in-place order. I think if they're traveling out to go fishing, that shelter-in-place means you shelter-in-place. But everybody makes their own personal decisions. Obviously, Dr. Pace, if you would have any comment on that.
Well, I mean, the preferred thing, people should stay home and not do essential travel only. I mean, that's really how we're trying to slow the spread. And now when we're starting to loosen it up a little bit and open the door a little bit, the temptation is going to be to, go for it. And if things start getting bad, then we'll have to clamp down that much harder. So as much as people can adhere to kind of the orders, the safer it's going to be. But we're all trying to work through this together. So, and I think there's, part of this is the social contract. Everybody wants to do what they want to do, for sure. And but I think, thinking about some of the comments earlier in the public comment about the older folks and the people that are medically compromised, part of what we're doing is trying to protect them and keep them safer by really controlling the spread of this virus in the community. So, I encourage people to think about your neighbors and your friends, especially those folks that are more vulnerable, and do what you can to keep it from coming in. So that's all.
Okay. Jake, you have another one?
Okay, yes, I have one more. This one is from D. Camacho. This person had to leave, so I said I would share their comment if we could. The problem with opening too soon is people going back to work and giving up unemployment and having to reapply. Restaurants bring in food, then having to close. I have sat in meetings with Dr. Pace and only have good things to say about him. Thank you for all that you do.
All right, thank you. Bruno, go ahead.
All right, I received this from Jay Wayland. Obviously, Lake County has taken a more restrictive approach than the state in general by basically shutting down lodging business. I believe we are among only 2 to 3 counties in the whole state that has taken this approach. I realize the idea behind the decision being to try to limit out-of-towners from coming to the county. However, I question that on a couple of fronts. For one thing, it seems like the majority of COVID cases that we've had so far are actually from locals going out of county and coming back with the infection. Also, we're not the only area in the state that's relying on business from out-of-towners. However, the majority of those areas have not imposed these lodging restrictions, and there doesn't seem to be any evidence indicating that doing so has caused them to experience a higher rate of infections. Lastly, there are a couple of lodging businesses that are still doing business with guests that are deemed to be in essential categories. It feels like I'm being prejudiced against because my business is unable to secure that clientele. To put the business side in perspective, my hotel is down to around 5% occupancy for the month of April. The same number for last year was around 60%. My business may not be able to survive much longer at the current level, and I'm sure that there are many other businesses in the same situation. Apart from the financial impact to my business, we have 9 employees that are basically at 0 income right now. As everyone is aware, the unemployment system has been very difficult to navigate. Fortunately, the number in terms of COVID cases have been much lower than anticipated. I think we can remove the restriction on lodging facilities and still maintain caution in terms of COVID exposure risk. Our facility has taken extreme precautionary measures in how we do business to minimize the risk. At this point, we need to put some trust in the county's residents and business owners to make prudent decisions. We need to do this before it's too late.
Thank you, Bruno. Supervisor Brown, are you trying to unmute yourself, Supervisor Brown, or are you typing something?
I can't lip read, but I think he said he's good.
Okay. All right.
I wasn't
There you
trying
go.
to unmute myself. I was typing something, but since
Oh,
you
okay.
asked.
I didn't know. It looked like you're reaching towards the screen, so I was just checking.
Yeah, sorry. I was responding to somebody that asked me a question directly.
Okay.
But I do have a question. A couple things. One, over that last, I got that same email. In fact, I sent him to Bruno because it's in his district. And Dr. Pace, I thought it was my understanding that the travel lodge was actually contracted with the health department to be available for quarantine cases. I know for a while there was a daily change in the plan, so I don't know where they fit into that because I just quit calling in on the meetings. It was kind of pointless for me. So,
I'm not sure where it's at right now. There was a lot of discussion with the travel lodge that, there were a couple different avenues of negotiation. I'm not sure where that's at right this second.
Are we renting any units right now that we're
it looks like,
it looks like Denise has an answer for that.
Yeah. Looks like, yep, Denise is on. So Jake, if you could open up Denise for comment, I'd greatly appreciate it.
I see her on. Denise, you might need to connect a form of audio, maybe call into the Zoom meeting, or maybe she's in here.
I see her in the room here.
Her name is here. You wouldn't happen, she's not the phone number 1929. I'm on phone. Is this you, Denise?
Yep, I'm here.
Okay, wonderful.
Hello. Hi,
Okay,
everyone. Thank
Denise,
you.
go ahead.
All right. So there's a couple things going on with some hotels around the county. The Travel Lodge is a hotel that the health department has contracted with for somebody if we need to quarantine or shelter them in place. So that's a per night rate that we currently have with them. We also have a hotel on the north side of the lake, the Skylark, that we are contracting with for the same purpose. There are other hotels that the Project Room Key has contracted with in Clear Lake for a similar purpose. So I hope that answers the question.
So when you say we're contracted with them, they're just made available as we need them. So we're really not paying any money for them to be reserved.
So the one in Clear Lake, that's it. We have an agreement with them that will use them for a particular purpose, and we'll have a per night rate. The one in Lakeport, we are paying for a block of rooms, so we have them available at any moment.
So I'm curious how much we've spent on that and how much that contract is for. I don't remember seeing that kind of.
I don't have those numbers off the top of my head. We are looking at adjusting that. We have not officially put somebody in the hotel yet. We've had 3 different cases that we were preparing to, and then for different reasons, we didn't. So we are going back and looking at that contract. I'm actually, Katie Galvani in logistics is looking at it for an update for me for tomorrow.
Is there a way we could get a copy of that contract and how much it's cost us and how much it's going to cost us?
Well, this is actually going to be paid for through a program that the health department has applied for a CERT program grant. So I want to say it's $50 a night per room, and we currently have 16 rooms blocked. But we're going to be looking at revising that to doing a tiered block of like 5 rooms at a time, since we haven't had the big need. By this time, we had thought we would need 10 to 20 rooms. That hasn't manifested. So we're looking at revising it to a smaller block.
So we're paying $800 a night for a block of rooms. And how long have we been doing that?
Just a little over a week.
Okay. So that's all that we've paid? Well, $6,000. So.
Right. That's what the program is paid.
With the tax.
But again, we're looking at revising that to a smaller tiered section of smaller block of rooms.
Okay, yeah, I'd like the information on that and how much it has cost us and how much it will continue to cost us if I could. Thank you.
Absolutely.
Thank you, Supervisor Brown. Supervisor Scott?
And I just want you to know on Project Room Key, as of yesterday morning, they had 6 guests in the hotel plus 1 used for an office. I missed the call today because I'm here, but I think they were going to be adding, I believe, 5 more guests in that project today. I believe they can go up to 15.
Thank you, Tina. Denise, thank you very much. That was Denise Palmer. I forgot to ask her to to announce herself. I apologize, Denise.
That's okay. Thank you.
Supervisor Sabatier.
I'm good, but since you called on me, I am looking for, and I guess I'll just have to put something on the agenda, but I feel like we need to keep pushing on our end to be able to ensure, not ensure, we can't ensure anything at this point, but to keep pushing for local control. Again, I don't think any of us are looking to blast open the doors, but I think that I'd like to look at those next steps. And obviously, this is just a discussion of COVID-19 from the public health. So I will just place something on the agenda for next week.
Okay, thank you very much.
So I agree with that. I think we need to have that control, but we need to have it in any event, because even though this has never happened before, it's going to happen again. They found out how easy it is to control everybody's lives, and so they're going to keep continuing to do this, whether it's, you know, good reasons or not. They're able to do it. They'll find a reason, a justification to do it. But I did have another, you know, I asked a question earlier and I never really got an answer to it. Maybe there's not an answer, but what is the plan for next fall? Because that's, you know, we can wait around and talk about that, you know, in October, or we can start talking about the inevitable now. So I don't know if there's a discussion at the federal or state level on this thing coming back around, but it's going to come back around because we protected ourselves from it during the spring. So it's going to bite us in the ass in the fall. So I just want to know what the plan's going to be.
Dr. Pace?
Yeah, well, I mean, I absolutely agree. I think you're right on. The head of the CDC just last week basically started suggesting that when the flu season comes in and the kind of probable activity of the coronavirus, the way these things can often be seasonal, we're not sure whether this one is going to be or not, but between having flu and COVID together, the fall has the potential to be a real problem. That's part of my interest, and we're actually pushing to open faster than some of the other areas, because I think the economic impact has been so hard here that it's important to try to loosen things up and get some activity going for the summer and get some of the kids out into more social and educational activities this summer when possible, because I think it's very likely we will need to be closing down in the fall. To get some virus transmission through the summer is probably a good thing to help with immunity. I think it's unlikely we're going to have any kind of vaccine by the fall. I think we may have some therapeutics so that when we'll know how to treat people better that get sick. So how to, and we also have the risks of PSPS and fires to layer on top of all that. So all those together are concerning about how to deal with the fall. I think you're right, Supervisor Brown, that it's a significant concern of what it may look like in October, November, December. So the interest is to try to open this thing in as safe a manner as possible and allow some transmission amongst the healthier folks to try to get some more herd immunity. And then hopefully in the fall, we'll be able to maybe not shut down all of society like we had to do this time, but to figure out how to protect the most vulnerable folks and keep them safe and allow a little more activity to go on in socializing and in commerce. I think that's sort of the general thoughts, but you know, how that's actually going to look and what's going to unfold over the summer still remains to be seen.
Okay. All right, with that, we're going to go ahead and obviously what I didn't do was close public comment, bring it back to the board. I think we'll do that at this point, and we'll try and wrap things up here. Supervisor Sabatier.
And I appreciate the comment being made about the potential second wave that there's been a lot of articles about. And I know that Dr. Pace said a term, herd immunity, but at the same time, we're not 100% sure if herd immunity works in the same way that we've seen it work for other viruses. We're still learning whether or not that really truly exists. However, shutting down in fall is not the conversation I'm looking to have. I'm looking to have the conversation on how do we open up in a safe manner so that we know how to navigate through our daily necessities, which includes work, which hopefully will include school as well, and other functions, so that we can reduce the potential medical catastrophe that this could be if it becomes a large issue. If we can figure out how we can set it up so that we can get back to the things we need to get done, then I'm sure hoping that we don't have to deal with that in September, October, November, because that's the same time PSPS is anticipated. That's the same time we plan on looking at potential fires. I mean, it's going to be a really bad fall. I hope that we can be better prepared than having to shut back down.
Thank you very much. Apologize about that. Okay, if there are no more comments at this point for Dr. Pace, we're going to go ahead and move on from this issue. I want to thank you, Dr. Pace, for spending the time with us today. Once again, every week with these updates, I think they're very important to get out to the public, let alone just reading our orders that are coming out. This is a great informational time. I want to thank the board, all the community that's weighed in today on all the issues. So, Dr. Pace, thank you. I don't know if you have any closing comments.
No, thank you, Supervisor Simon. It's it's a challenging time, and I really was impressed to see how the community was able to manage last weekend. That was very heartening that we can continue to move forward. And I think all the planning and all the suggestions everybody's been putting forward are really helpful. And we're just going to try to weave this together and move forward. I'm looking forward to see what the governor, when he starts to loosen things up so that we can really kind of get some businesses opening again. Thank you.
All right, thank you very much, Dr. Pace. Okay, I know as we move along our agenda here, I know that each and every time it kind of extends as we go. What I would like to do as we move forward is I think we would be able to deal with item 4.1. And then what I would like to do is take a lunch break from 12 to 12:30 and then reconvene, and we can start and work through the rest of the process of the agenda. So,
Chair, would you like to take up 6.3 while we have Dr. Pace with us, since that's a health item?
Scroll down, I apologize. Our 906 item, consideration of continuation of a local. Yeah, I guess it would. Yeah, instead of having to call him back, because I know he's got other things he needs to do. So we'll go ahead and address item our 905 or 906 AM item, 6.3, consideration of continuation of local health emergency and order prohibiting the endangerment of the community through the unsafe removal, transportation, disposal of fire debris for the Mendocino Complex fire. I don't know if Dr. Pace can deal with that or Denise. Go ahead.
Usually I bring this up. This is basically the continuation of the emergency order to try to get the sites cleaned up out in the forest from the previous fire. So we're still waiting for Cal OES to come back through, we've had some contact with them recently, and they were kind of pushing it down the road because of the concerns about moisture. Now it looks like things are drying up, so it's basically just an extension of the emergency proclamation, so that to allow them to get things together and come out and clean up. I haven't reached out to them since the last time we met. I'll do that today, because they had said something like, I think it was May or early June, that they were planning on coming out, but they kind of keep pushing it down the road as well. And so I need to get back on bugging them. But this is basically just an extension for that, so that the county doesn't have to accept the costs and the state will pay for it.
All right, any questions from the board? Supervisor Sabatier?
I don't mean to speak for Supervisor Crandall, but I want to say that we are available if you need us on that phone call to help push Cal OES to let's clean this off our table so that we can focus on the true emergency at hand, rather than having some more delays to keep this on our agenda for months to come. So if you need us, please use us.
Okay.
Thank you.
Any more questions from the board?
No, I'll just add in sorry, I heard something. Did you go into public input yet?
No, not yet. I'm getting ready to do that right now.
Okay, I'll wait for you then.
Okay, we'll go ahead and open this up for public input. Carol or Jake, do you guys have any comment on this item, 6.3?
I do not have any general public comment. Everything I had for today is specific to certain agenda items.
Okay, thank you very much, Carol. Jake, can you open up the room if there's any comment on item 6.3?
I don't have any raised hands. Would you like me to unmute the floor?
Yeah, if you could unmute it for just a second, we'll see if anyone has a comment.
Okay. All right. So everyone is unmuted. If you would like to make a comment on the current topic, please state your first and last name.
Okay, hearing none, we'll go ahead and close that up, Jake, and we'll bring it back to the board.
Real quick.
Yes.
I'm going to mute everyone because there's a lot of names to click through on this one. So please check your mute after I hit OK.
Okay. Okay, Supervisor, thank you very much, Dr. Pace. Supervisor Crandall?
Yeah, so just adding to what Bruno had stated, yes, if you need us on those calls or anything like that, this has been something going on for quite some time. I'm glad to be available for you. But I will go ahead and move to approve the continuation of a local health emergency and order prohibiting the endangerment of the community through the unsafe removal, transportation, disposal of fire debris for the Mendocino Complex fire.
Thank you. There's been a motion and a second. Can we go ahead and have a roll call vote?
Sorry about that. Yes.
Thank you, Carolyn.
Supervisor Sabatier,
Aye.
Supervisor Crandall,
Aye.
Supervisor Scott,
Aye.
Supervisor Brown,
Yes.
and Supervisor Simon.
Yes.
Thank you.
Okay. I'd like to do, I know we've got a long meeting. We're going to be here for a while. We'll go ahead and take a lunch break from 12 to 12:30, and then we'll come back and reconvene and work our way through the rest of the agenda here. That if the board doesn't want to do that, we can push through, but I know at least we're going to have to take a break here for a while. Thumbs up.
I'm good.
Okay, thank you very much, board. We'll see you again at 12:30.
Okay.
Ready, Mr. Chair.
Okay. Yeah, we are ready. So we're going to go ahead and reconvene the April 28th meeting at 12:35. We'll go ahead and we're going to finish with the rest of our agenda this afternoon. We're going to start with item number 4.1, an extra item that was added, consideration of letter to Senator Wire Assembly Member Aguiar Curry requesting they urge Governor Newsom to request a 3-month extension for FEMA for funding for the restaurants, delivery, home meals, and seniors program. And we'll go ahead and turn this over to Supervisor Scott.
I'm going to have Carol introduce this item, but the reason why we have this item on here is because we were having a Zoom meeting yesterday discussing this project and realized that we really needed to bring it to the board, not only for a letter showing that we need an extension, but to let the public know that, we are working on this project because there was some public concern about what we were doing about this. But I'll hand it over to Carol.
Thank you, Supervisor Scott. Yes, we met yesterday with you and Supervisor Crandall, and then also with Crystal Marketan, the DSS director. And as we were looking at the very limited guidance that there is available on this program, it became pretty apparent that there are a lot of questions that need answers in order to be able to move forward with it. And in your agenda packet, you should be able to see the very brief overview and guidelines Cal OES has provided. It's just 2 pages of preliminary information at this stage. The eligibility for this new program is really quite different from the other local programs that we presently have in place. It's unlike our senior meal programs. It's unlike our food programs, such as the SNAP program, which is the program we all used to know as food stamps, or again, the home delivered meals that our senior centers provide that are largely funded by the Area Agency on Aging. But what we are understanding preliminarily is that that folks that receive nutrition through those other programs would not be eligible for this. And in fact, if we are able to implement a program of this nature, those folks would not be able to switch programs to benefit from this. It's not clear to us yet, however, if since in the senior meal program, for example, people just get a noon meal, if it would be possible to fill in the gaps with the other meals, morning and evening meals, because this program talks about 3 meals a day. But again, the requirements for this are pretty different. This is a program that's been rolled out quickly. Cal OES is the administrator of it. And certainly whatever we do, we would need to do in coordination with the senior centers, so we were sure we were zeroing on the right client base in terms of eligibility. So it has to be folks that are 65 and over or otherwise at high risk. They either have to live alone or with another eligible adult. The income range for these folks is much higher than those typically connected to the other programs. $74,940 a year for a household of 1, or as much as $101,000 for a household of 2. It equates to 600% of the federal poverty limit. Eligible individuals have to affirm that they're unable to prepare or obtain meals on their own. And so what we're asking for, in fact, I'm grateful to Supervisor Sabatier for raising this issue on the regional call force that helped us decide our next course of action. What we're asking is for your board to do today is approve a letter that would go to our state elected representatives asking that they urge the governor to seek an extension for this program. The program is presently only funded by FEMA through May 10th. And for what it would take to stand up this program, it just couldn't possibly be done and implemented that fast. It would, a questionable amount of effort that it would take. So, however, if we were given an extension, if we had the additional 90 days that we understand is already being contemplated, and we just want to make the point that it is essential, staff could then do some outreach to determine what level of need we would have here in the county. From that, we could then develop some costs for the program, and depending on the outcome of all that, if it appears feasible, we could assign staff who would conduct eligibility assessments with folks to make sure they meet that criteria. Since this is a FEMA-funded program, you have to get it right in terms of determining who is eligible, or your costs won't be reimbursed. And then, of course, we'd need to enter into contract with local providers, and typically those are restaurants or folks that have industrial kitchens, and they would be required to prepare the food and also deliver it. Individuals making the delivery have to have completed a background check to ensure that the folks they are delivering to are safe. So that's the long and the short of it. We're just asking your board to approve the letter to Senator McGuire and Assemblymember Aguiar Curry, urging them to urge the governor to pursue an extension of this program so we can determine its feasibility here.
Thank you very much for that, Carol. Supervisor Sabatier.
And I just want to say, based on the guidelines, it says that the local share, because we know that FEMA never typically plans on paying 100%. Sometimes we can ask them to pay a bit more than their 75% share, which is typical. Here it says that the local share would be 6%. And I know that we talked about possibly excluding the lunches to allow the senior centers to continue. But if it was for the full amount, which is $66 per day for breakfast, lunch, and dinner, the local share of that we would be looking at paying is $3.96 per day per person. Just wanted to put that out there since there is a potential cost for us in the long run.
Supervisor Brown.
We can also look at in-kind options on that too. We've done that before. An example of that would be the health department inspection permit, waiving that for the year or something. There's something that there's things that we can do that don't actually cost us anything.
Yeah.
Supervisor Crandall.
Yes. So, thank you, Bruno. That's actually, I had that number yesterday. The state would pay $12.54 and FEMA would pay $49.50. If FEMA doesn't cover it, of course, that would probably be our burden, right? The $49.50. So it's like $53. From what I understand, and I may be wrong, someone else can correct me, is that this would be an agreement with local restaurants. They would get paid for making these, and we were also discussing possibly allowing them to decide how they would deliver it. There was also a discussion about possibly doing this in the actual communities that they're in, so there wasn't so much travel included. But of course, that's a lot more that needs to be ironed out at a later date. And the amount that it 75 or what is it 75,000 is at the 600% poverty above the poverty level, and 2 people would be 100,000 people. So this wouldn't be ideal for anyone that's already being served with CalFresh or with the local senior centers. This would be folks that are having difficulties otherwise. So that's a different number that the department would have to get in place.
Excellent. So obviously today we're looking at just a letter of support to look into this more, see if we can get the extension, which, I think every opportunity we need to look into. But, I already know, I will let you know, I don't know if anyone else has been contacted. I've been contacted by my local senior center that someone has already put something on Facebook that restaurants need to be contacting maybe the Lakeport Senior Center and start signing up for this thing, that the program's already being rolled out. I was called with a concern on that this morning. I don't know if anyone else was addressed with that, but I just want to make it clear that this is a program we're looking into. It isn't up and operating at this point. We're looking for the extension, and I just want to get that out there. But I started getting calls this morning, and appreciate the letter being here and looking into it. But I know that there's already some community expectation by some stuff that was put out there. Go ahead, Tina.
I just want to thank you for bringing that up, and we're trying to contact the Lakeport Senior, or I have contacted the Lakeport Senior Center, letting them know that we are in the process of looking at this, that they need to cease doing what they're doing, and we will contact them once we figure out what the county is going to be doing. But that was one thing why it was really important for me to bring this out into a public meeting, so they know that we're working on it and what steps need to happen for this program to be rolled out.
Thank you, Tina. Thank you. Supervisor Sabatier.
And again, like I said earlier, I believe it's already going through the process to see if the extension can happen in Sacramento right now. Our letter is going to help support that to make sure that we help lean in the positive results. obviously I'm in favor of this letter, but I'm going to ask Tina and Eddie, or Supervisor Scott and Supervisor Crandall, please continue the organization for this so we don't start and we don't wait for the legislature to make their final decision. If we can have some organization ready to go, once we know we're going to get the money for it, boom, let's go. And we already know we're going to get the money until May 10th, but it seems positive that we're going to get that extension.
We definitely will.
Thank you, Supervisor Scott.
Mr. Chair.
Go ahead, Carol.
One other comment too about the one senior center that has attempted to take on recruiting clients for this program. This program is different than what the senior centers provide for different client base. And if by chance people somehow left the senior center program, meal program, and got onto this one, it would probably cause funding problems for the senior center down the road. When their meal counts drop for the Agency on Aging program, then down the road, their funding also would be adjusted. And I know that was the experience during one of the fires when one of the centers was used for some sheltering operations. So it really is a very different program. And if it is feasible here, the county would be the one that stands it up and seeks people that are the right fit for this program. So thank you.
Okay. Thank you. Okay, we're going to go ahead and if there's no more comments from the board, we'll go ahead and open up public comment. Carol, do you have any public comment on this agenda item that was added today?
I do not on this one.
Okay, Jake, can you open up the room and see if we have anyone who has comment on this 4.1 item?
Yes, I can open up the room. I don't see any raised hands, so I will unmute everyone on the floor. Okay, the floor is unmuted. If you would like to make a comment, please state your first and last name.
Hello, hello.
Hello?
Hello, do we have someone who wants to make comment? Hello, that was about it.
I think I know who that was, and they might have just been testing.
Okay, all right. Well, we'll go ahead and close the public comment at this point and bring it back to the board. Supervisor Sabatier.
So I'm not aware of every single senior center, but I know the senior center here in Clear Lake has been getting some very valuable donations from Rotary. I think some of the other senior centers have also been getting a little bit of help. I have not seen or heard, so I just may not know and not be aware, if the AAA has increased any of the funding to provide to those senior centers, because maybe that's something we need.
Yeah, but I think that's a different item at this point, Bruno.
Okay.
We're talking directly about the letter on this item 4.1.
You know what, Bruno? I'll contact about that.
Okay.
Excellent. Thank you very much. Okay, here no public comment. We'll bring it back to the board for action on item 4.1.
Mr. Chair, I move to approve a letter to Senator McGuire and Assembly Member Agri-Curry requesting the urge Governor Newsom to request a 3-month extension from FEMA for the funding for the restaurant delivery home meals for senior program.
Excellent. Is there a second?
Second.
Motion by Supervisor Scott, seconded by Supervisor Sabatier. Carolyn, can you please give us a roll call vote?
Yes. Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Yes.
And Supervisor Simon?
Yes. Thank you, Carol, and Supervisor Scott and Crandall. Okay, moving right along, we have, we're going to move to the consent agenda. Consent agenda items are usually non-controversial. Anyone from the board can pull an item, and I did have a email request this morning to pull item 5.11 from Supervisor Sabatier, 5.11. Are there any other items that need to be pulled from the board or would like to be pulled? All right, here none. We'll go ahead and open it up to the room or any public comment on any items that need to be pulled from the public. Carol, I don't know if you got any correspondence, but Jake, go ahead and open up the.
Nothing on my end, Mr. Chair.
Okay, Jake, if you can open up the room.
Yes, I can. All right, the floor is unmuted again. If you would like to make a comment, please state your first and last name.
Okay, here none, we'll bring it back to the board for approval. Consent agenda items.
Mr. Chair,
I'd like to.
Go ahead, Eddie. EJ.
Okay. Mr. Chair, I'd like to move to approve the consent agenda items 5.1 through 5.10 and 5.12 through 5.17.
Second.
There's been a motion and a second. Carolyn, if you do the roll call vote.
Yes. Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Yes.
And Supervisor Simon?
Yes. Thank you very much. Pulling item 5.11, do we have, go ahead, Supervisor Sabatier. Let's take that up right now.
Okay, thank you very much. So the reason I pulled this one was just for clarification and transparency purposes. There is a, I believe, around $154,000 price tag attached to both of these agreements. But in the agenda details itself and the memo, it did not specifically state about the costs. So I just wanted it to be, let the community be aware that the compensations, and I'm scrolling, sorry, I didn't have it right here right away, is $80,000 for the, sorry, let me be specific, $80,000, $80,325. And this is for the waste discharge requirement, WDR, as it's discussed on the other one. And for the monitoring and reporting program, the total compensation is $61,050. I just wanted to be transparent with the cost of both of these agreements. And I approve of these agreements. These are necessary to function the landfill to ensure that we're doing the right thing environmentally. And I don't know if Mr. Ewing was here.
He is in the room, and I figured I would ask any of the other board members if they have any questions or concerns. If not, I'll go ahead and turn it over to Lars, if Lars would like to comment.
Mr. Chair, this is Lars Ewing. Happy to comment. Supervisor Sabatier, after this, as you mentioned, and answered the questions on the costs. Happy to answer any other questions, but I apologize that I did not include those in the memo. That was just an oversight on my part.
No, we appreciate the hard work of getting things on the agenda right now. It is a different time, you know, some things do slip through. So obviously, hey, we appreciate everybody working hard to get things completed. And I know sometimes those issues happen. So in this virtual reality world, I don't think there's no need to apologize, but thank you very much for the clarification. And thank you very much for the hard work you're doing, Lars.
All right, thank you.
Okay. If you mute the room again, Jake, we'll bring it back to the board. We'll go ahead and close public comment and bring it back to the board for action.
Mr. Chair, I move to waive the competitive bidding process in accordance with County Code Section 2-38.2 because it is not in the public interest due to the unique nature of goods and services.
Okay, is there a second? Supervisor Crandall seconds. We can go ahead and do a roll call vote. Carolyn?
Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Yes.
And Supervisor Simon?
Yes.
Thank you.
And Mr. Chair, I'd like to do
yes.
both of the next B and C in one single motion. I'd like to move to approve agreement between the County of Lake and SH.
I'm sorry, I hate to interrupt, but you
Yeah,
can't do that because they're separate agreements for different things. So you do have to do them separately.
I was risking the interruption, so thank you for interrupting.
Sorry, I'm sorry. Thank you.
I move to approve agreement between the County of Lake and SHN Engineers and Geologists, Inc. for technical support services for East Lake Sanitary Landfill 2020 waste discharge requirements, and authorize the chair to sign.
Seconded by Supervisor Crandall. Carolyn, if you go ahead and call for the vote.
Supervisor Spatier.
Aye.
Supervisor Crandall.
Aye.
Supervisor Scott.
Aye.
Supervisor Brown.
Yes.
And Supervisor Simon.
Yes.
And finally, I move to approve agreement between the County of Lake and SHN Engineers and Geologists, Inc. for technical support services for East Lake Sanitary Landfill 2020 monitoring and reporting program, and authorize the chair to sign.
Is there a second?
Second.
All right. Excellent. Carolyn, go ahead and call with the roll call vote.
All righty. Supervisor Sabatier.
Aye.
Supervisor Crandall.
Aye.
Supervisor Scott.
Aye.
Supervisor Brown.
Yes.
And Supervisor Simon.
Yes. Okay, we'll go ahead and move on to item 6.2, public input. Carol, do we have any public input that is not specific to items on the agenda today?
None that I have received, Mr. Chair.
Excellent. Jake, well, I guess we don't have any in Zoom, huh?
No, there's no raised hands.
Okay. Sorry about that.
You know?
Okay, we'll bring it back to the board here. We'll move on to item 6.4, 10 a.m. Consideration of an update on community choice aggregation, CCA, and direction to staff in the future efforts.
Thank you, Mr. Chair. Matthew Rostein and Susan Parker have worked on this issue over the past year, and Matthew is going to present it to you today.
Good afternoon, board. Thank you for the opportunity to address you this afternoon. And I also wanted to apologize for my line check a moment ago. That was me. Was just trying not to interrupt the proceedings further at that time. Well, as you are aware, community choice aggregation is defined by the Environmental Protection Agency as programs that allow local governments to procure power on behalf of their residents, businesses, and municipal accounts from an alternative supplier, while still receiving transmission and distribution service from their existing utility provider, in our case, that'd be PG&E. On June 23rd, 2015, the Lake County Board of Supervisors unanimously passed ordinance number 3026, authorizing implementation of a CCA in Lake County. At the time, the reasons for that were we were seeking cost savings for residents, and also there was a thought that there may be an opportunity for general fund revenues. And of course, as you're aware, in the fall of 2015, the Valley Fire happened and many different county priorities had to shift. There were also changes in the regulatory environment surrounding CCA at that time. There were changes primarily to exit fees, which are also known as power charge and difference adjustments. And so the cost of implementing CCA got higher for any jurisdictions considering it as of that time. And by the time that March of 2016 rolled around, CCA rates for those newly joining were actually similar to or even higher in some cases than PG&E. So in light of all that the county was managing and the fact that PCIAs had already changed the value assessment a little bit, a community choice aggregation was put on the back burner at that time. And then ultimately in 2019, the Space Committee determined that if we were going to look further at CCA at all, joining an existing program was going to be the most practical possibility. And Sonoma Clean Power is the geographically closest program of this type. Following meetings with Sonoma Clean Power's CEO, Jeff Cyphers, in mid to late 2019, that ultimately included Assistant County Administrator Susan Parker and representatives from the cities of Lakeport and Clear Lake. Sonoma Clean Power generously undertook a detailed feasibility analysis to consider an offer of service to Lake County. And they did that at zero cost to any Lake County entity. The study results unfortunately showed that Lake County residents' energy rates would be an estimated 8 to 13% higher than with PG&E if we were to join Sonoma Clean Power now and commence service in 2022. There were two primary factors that drove that cost difference. The first is that Lake County has a limited number of commercial and industrial customers, and the second is that those power charge indifference adjustments continued to rise in the interim period. So clearly the timing was not right for anyone concerned, and Sonoma Clean Power elected not to extend an offer of service. The regulatory environment surrounding PCIAs, those exit fees, again, is not generally favorable right now to entities with limited commercial and industrial customers. And staff believes, at the end of it, and in consideration of Sonoma Clean Power's study, that advocacy regarding policy changes.
Can we just pause for a moment? I'm sorry to say that Supervisor Scott got disconnected, so we need just a moment to let her come back. She's working on it.
Okay.
Sorry, Matthew.
That's okay.
All right, we'll take a 1 minute break here, or a couple minute break until she comes back.
So I'm not entirely sure where Supervisor Scott left off, so just want to recap it. Sonoma Clean Power conducted a full feasibility analysis. It was very work intensive at zero cost to any of the Lake County entities, and they found that their rates would be 8 to 13% higher than PG&E's if we were to join Sonoma Clean Power right now, and service would start in 2022 if we joined right now. And those costs were driven primarily by the fact we have limited commercial and industrial customers in Lake County, and power charge indifference adjustments, or exit fees when a community leaves service with PG&E. So clearly the timing wasn't right for anyone concerned, and Sonoma Clean Power's board ultimately elected not to extend an offer of service at this time. And I wanted to clarify that the regulatory environment surrounding PCIAs, the exit fees, is not generally favorable to entities with limited commercial and industrial customers joining CCAs right now. So staff believes that advocacy regarding policy changes is our best available CCA related opportunity right now. And thankfully, although they were not able to extend an offer of support, an offer of service rather, Sonoma Clean Power's board has a genuine interest in continuing to help Lake County in some way. And already offering the study was a great demonstration of that. And now they're wanting to help with advocacy support. So again, the basic perspective would be that regions with limited industrial and commercial customers should not be totally excluded from CCA, and also that a more appropriate long-term planning process for exit fees or power charge and difference adjustments may be available, given that the current state strategy is inhibiting competition in some areas of the state. And so also the final thing is they're also willing to offer some support in advocating for some areas of Lake County to be designated disadvantaged communities. Your board is probably aware that with the exception of tribal lands, the County of Lake has currently no designated disadvantaged communities. And the reason for that is that the instrument that's used to determine eligibility heavily weighs air quality. And so essentially in the past, Lake County's air quality has been so good that we haven't qualified for disadvantaged communities. So if we are to engage in this advocacy efforts, Sonoma Clean Power has asked that your board provide a representative that would be willing to be a part of that. And other than those advocacy activities, staff doesn't believe that there's an immediate need to continue evaluating CCA on an ongoing basis right now. So we would recommend, like Sonoma Clean Power's board did recently, pushing the next analysis out towards sometime probably the end of 2021, unless something significantly changes in that time. And I've been informed that Supervisor Scott has expressed a willingness to be your board's representative for those advocacy efforts. And that's my report for this time. I'm really grateful for Supervisor Scott having that willingness. And let me know if you have any further questions for me.
No, obviously, I want to thank everybody, Susan, Matthew, everybody who's worked on this, Carol, everyone on the board that has had this conversation. I know I'm glad that we got to this point. A little disappointing with the answer and looking at what happens there. Obviously making a change, you don't want to make a change and then let everybody know their bills are going up. That's one of the hardest things and challenges we have here locally already, and compounded by PSPS and everything else that's happening with our local provider, or PG&E, our main provider. So appreciated all the information in the packet. There was a whole bunch. I know there was the checklist that went down, neighboring communities, other things like that. Looked at also the potential financial implications that come with the changing over. So it would be the first time for myself, but appreciate the hard work that was put into it, and definitely think that we need to continue. So I do appreciate Supervisor Scott stepping up to help drive this thing for a long-term discussion, and we'll just bring back to the board. So Matthew, thank you very much.
Thank you.
Supervisor Sabatier.
I had a conversation a while back with an energy consultant who was bringing us ideas, and Matthew took part in this conversation about creating assets which would generate electricity, which then could potentially be sold to a community choice aggregate. And so maybe that conversation could be bridged into this conversation to see if maybe in the future we can look at both and marrying it together, where we can give some advantages to working with CCAs outside of our community, and then also generating enough electricity so we can benefit from that and not have a higher rate than what PG&E would be offering. And so maybe it's not just continuing as is, maybe it's bringing in some of those other conversations into the CCA conversation. So just as a, I just want to make sure that Supervisor Scott was aware of that. I'm happy that we're going to continue the conversation, and it's obvious we don't want to go somewhere where it's going to cost people more just because it feels good with what we're doing. That's not what we're trying to do.
Thank you. Any other board members at this point?
Just that I
Supervisor
agree
Scott?
with your sentiments that you were saying, that it's disappointing that it came back higher. I know we're all looking to have clean energy, and but to have our constituents have to pay more for it, it's just not something we should do at this time. But it's something that we should continue to follow. And I like where Supervisor Sabatier is going, as looking in other directions too, to see what we can do to maybe lower the and have clean energy. It'd be a win-win.
Excellent. Any other board members comment on this item before I open it up to public input in the room?
And I was happy that Matthew brought up the disadvantaged communities. I would like to follow up on figuring out how to identify through the CPUC, because it's through the CPUC's mapping that we're seeing that we're not on the map, because maybe we're missing out on some certain grant opportunities or certain other opportunities by not having some of those designations. And so if we can also follow up on that with Supervisor Scott's leadership, that would be good too.
Excellent. I agree. And hopefully, we have got CPUC to Lake County for me before COVID. So let's hope we have someone that's willing to listen to us and entertain those conversations about the disadvantaged community. And boy, all right, if there's no more comments from the board, going to go ahead and open it up to public comment. Do we have any public comment on this issue?
Mr.
Carol?
Chair, I do. One piece of public comment came into the public comment email address. It comes to you from Elizabeth Larson, editor and publisher of Lake Co News. She says, regarding item 6.4, I have several questions about the reported involvement of Carol Cole-Lewis and Denise Rushing in the community choice aggregate matter. What form did the support from Cole-Lewis and Denise Rushing take? In May of 2018, were they involved in any other consulting for or negotiations with the county? What was their specific interest in this matter? How was their business in line to benefit from CCA being implemented? Were they paid or offered other considerations? Were other individuals or businesses in the energy industry asked to consult the county? What expertise qualified them for consulting the county in this capacity? What did they ultimately contribute to this effort? Are they still acting in any type of consulting capacity to the county? And that completes the public comment from Elizabeth Larson. That's the public comment email.
Okay, that's public comment. Is there anyone that could answer that question?
Yeah, I'm prepared to respond to that if that's okay with you.
Go ahead, Matthew.
Okay,
Go ahead,
so I
Matthew.
first wanted to emphasize that community choice aggregation was determined to be a board priority, was determined to be something that we were doing in 2015, which is well before the period that that Ms. Larson's email regards. So I want to make sure that that's clear before answering the question.
Okay.
But then more specifically to her points, in 2018, Ms. Cole Lewis and Ms. Rushing provided information only, and it was primarily regarding ongoing California Public Utilities Commission regulatory processes. And you would expect, I know your board has as well, many energy-focused businesses reach out and provide information over time. And our interest is always in evaluating what opportunities best serve county residents. That's our lens all the time. And I'm not willing to speculate regarding what Ms. Polis or Ms. Rushing's specific interests were or how the businesses may have to benefit. I will say in May of 2019, Denise Rushing did indicate Sonoma Clean Power may be open to conducting a feasibility analysis, and the county did subsequently reach out to Sonoma Clean Power as described in the board memo, and the highly valuable work-intensive study that you have before you today was provided at no cost to any of the county public entity as a result of those efforts. So that really ended up being a great thing. At no time did either Ms. Rushing or Ms. Polis serve in any formal consulting capacity surrounding CCA. And I can definitely say, as your board will, we'll continue to listen to information from any source that's helpful in promoting the interests of county residents.
Mr. Chair, I need to jump in because we may have a connectivity issue. I'm hearing that we may have some trouble with Granicus and Facebook, so I want to first check in with Carolyn. Any problem on your end with Granicus, Carolyn?
No, I'm seeing it fine. I'm checking it right now. It looks fine to me.
And then Sam, Facebook, okay? I heard there are people having trouble with that too. No. I don't think we want to do that. That would start the whole meeting over.
Yeah, Supervisors.
I'm just, I guess I'll just say what, rather than ask it, if you want to listen to the meeting, it'd probably be best to jump on Facebook or Granicus rather than on Zoom, because the entire meeting itself derives from Zoom. So unless you're here to make a statement, and even then, once we're on that agenda item, you can jump back on Zoom. But the more participants we have on Zoom, the slower everything else that's being streamed from this goes. So we want to hear from you, but if you're just listening, maybe look at those other avenues so that you can free up some of the bandwidth for Zoom.
And I'm continuing to get messaging that the sound on Granicus is garbled. And in fact, when Sam was responding, it was garbled. But somewhat.
That is kind of telling me that maybe Sam is experiencing some connectivity issues on his part in general. It might be worthwhile to have him drop out of the meeting and rejoin, because the computer that he's using there to speak with us is actually feeding both Granicus and Facebook, I believe.
And so if Sam drops out, we lose the Facebook feed that probably a lot of people are watching right now. If we were going to do that, I think we would want to do a reset on all fronts. And that's your call, Mr. Chair. It'd probably be a 5-minute delay if you want to restart everything.
Okay, so if we're going to restart everything, we're going to jump off and try and just get right back on in 5 minutes. And do we think that's going to fix the problem? Or we guess
it's more of a guess. Maybe even restarting that computer, if we could do that. Yeah.
All right, so
I think that's an appropriate right there.
So,
All right, then we'll,
back
I got
24 after.
Yeah, look, I'm trying to get back on here. We'll go back to the Zoom in. The same invitation will work, right? Jake, we just go click back on that and it'll come.
Yeah, we can all stay here. It's just Sam that needs to drop out.
Okay.
Oh, okay.
Everyone. Here and just kind of hang out like we did for the last break.
We are on our non-tied items, item 7.2.
Actually, Mr. Chair, I think we still need to finish 6.4.
We didn't finish 6.4. I apologize. I thought I had brought
Matthew, we still need to appoint Supervisor Scott, don't we? Or can you remind us where we left it?
Yes, so we do need to still appoint Supervisor Scott as the CCA advocate. And additionally, we're wanting your affirmation of staff's intention to next bring CCA before your board toward the end of 2021, mirroring Sonoma Clean Power staff's own intention to revisit CCA at that point in time, unless something significant changes.
Okay, we'll bring it back to the board for those action items.
I move to approve Tina Scott as our CCA representative.
Second. Seconded by Supervisor Crandall. Go ahead and roll call vote, Carolyn.
Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Yep.
And Supervisor Simon?
Yes.
Thank you.
And there was a part B to that about the recommendation that we come back in 2021.
So moved.
Is there a second? Excellent.
Second.
Carolyn, go ahead with the vote.
All right, Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Yes.
And Supervisor Simon?
Yes.
Thank you.
All right, thank you. Okay, moving right along here, we got item 7.2, consideration of resolution of the Lake County Board of Supervisors recommending that the county treasurer tax collector immediately implement procedures to facilitate taxpayer applications for penalty waivers and payment plans for the property taxes to assist county taxpayers during the ongoing pandemic. Supervisor Brown?
If I could just jump in, do you want the treasurer tax collector present for this?
No, she doesn't need to be down here for me. I've talked to her and she supports it. So.
Okay, thank you.
Yeah. So basically this came up, we had a discussion about property taxes, but this is a little bit different when we do supplemental tax and escape assessments that come up. And, while people can anticipate what their taxes are going to be year to year, these supplemental taxes and escape assessments come as a surprise. And now is not a good time to be surprising people with additional bills. And so basically I've asked that Bruno and I met with Carol and Elizabeth Martinez and Barbara Ringen about, some options, and Anita as well. And we came up with this, what I was hoping we would do, we're not able to do, and that is extend it for 90 days after the shelter in place. But what we can do is make people aware of what's already available to them and ask that the tax collector work with them to do these things that are in this resolution. The only thing that we would need to do, and I'm asking that the board do, is to consider that instead of implementing a date certain like we did with property tax, if certain day in June, that we actually implement it 30 days after the lifting of the shelter in place, because that will give us a definitive date, but we don't know when that'll be. But once the shelter in place is lifted, then it will become definitive. And those are the things that I think we should offer folks that have the supplemental tax and the escape assessments that are experiencing hard times through the shelter in place, and essential, non-essential, not able to work issues that we're facing right now.
Supervisor Sabatier.
Yeah, I wanted to add that our assessor recorder
director, Rich Ford, was a part of that conversation as well.
That's correct.
And I do appreciate this being here. I think it matches exactly the same issues that we were dealing with property taxes, in this, not in the sense that it's a regular thing, but in the sense that some people are not able to afford this because of the shutdowns that we've mandated. So I appreciate this being here. I do think that as soon as we know when the shelter in place will be completely gone, that we need to look at an extension, not for the payments of it necessarily, but for how long they have to put in the waiver. Because I want to make sure that the burden doesn't suddenly appear later on. And I want to make sure that they also have adequate time to be able to gather the funds needed to pay off, whether it's their mortgage, their taxes, whatever else might be behind, because I think we're going to see some big struggles when we reopen to allow people to catch up. So I think that this is a good start. And I hope that we continue to keep an eye on it, especially as we reopen, because we can't anticipate people to pay everything off 30 days after we reopen. So thank you for bringing this, Supervisor Brown.
And also, Barbara has indicated she's got some other ideas that will be helpful, and she's going to meet with Anita to go over the legalities of that and what can be done. But she does have some other innovations that she's wanting to come back to help, that would help people too. So I'm looking forward to that.
Okay, Carol, I see you're off mute. Carol, do you have a comment?
There is no public comment for this item, Mr. Chair.
Okay. Jake, can you open the room up, please?
Yes, I will move to open the floor. The floor is unmuted. If you'd like to make a comment, please state your first and last name.
Okay. Seems like we have no comments. So Jake, go ahead and mute the room. Oh, I'll bring it back. I'll bring it back here in just a second, Eddie. We'll go ahead and close the public comment and bring it back to the board. Go ahead, EJ Crandall. Go ahead, Supervisor Crandall.
Yeah. Thank you, gentlemen, for bringing this forward like this. I know that when we talked about it initially back before April started and the deadline was coming, we had a lot of different thoughts and ideas, and just doing this to give people the option to ensure that their property taxes won't put them in a jeopardize them and put them in a bad situation. It's really helpful, especially during this time frame. I'm glad that the tax collector is willing to look at other options as well. And I think that there's some other things we can look at even further when things get back to normal to help with some of the way that we pay taxes and accrue taxes, and the way that they accept payment and things like that. So thanks again, gentlemen.
Supervisor Sabatier.
There is one request, and I can't force the tax collector to do this, but I would suggest that we try to be as good and as lenient as possible for, it says here, due to reasonable cause and circumstances related to this crisis. We shouldn't have to make people jump through hoops of fire to prove to us that they lost their job. That should be a simple thing. So let's try to keep it as simple as possible for the proof that COVID-19 has affected you and impacted you financially. That way we can go ahead and move forward and quickly, so that there's no extra burden at all felt by these folks that are going to deal with this.
I can say after talking with Barbara that goes unsaid. She's committed to that already.
Okay.
Supervisor Crandall, do you have a comment? Okay.
I'll offer the ordinance or offer the resolution. There's nothing else.
Yeah, if there's nothing else from the board, go ahead, Supervisor Brown. He's already offered the resolution.
Mm-hmm.
We need a second on that, or?
No.
Yeah, Carolyn?
Okay, Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott? Aye. Supervisor Brown?
Yes.
And Supervisor Simon?
Yes. Okay, thank you. Moving on to item 7.3, consideration and a request to appoint negotiating team for the sale of portion of the surplus property located at 7175 South Center Drive, Clear Lake, California, APN 01-043-52. This was put on. Carol, go ahead.
Thank you, Mr. Chair. So as you remember, back on January 14th, your board adopted resolution 2020-05 that declared the subject property surplus. It's at 7175 South Center Drive in Clear Lake. And as you well know, it is a property where the Lake Transit Authority has expressed an interest in developing a transit hub. And that resolution included the need for your board to take action to establish a negotiating team to move forward with the sale of the property. And so we brought this back to you because it's time to take that action. We are aware that Lake Transit just recently got approved for a grant that will support them in purchasing the property and developing the site for their transit hub. So with that in mind, staff is recommending that you appoint a negotiating team that consists of myself, Assistant CAO Susan Parker, and Deputy CAO Stephen Carter.
Supervisor Sabatier.
I do want to clarify one thing. The grant that was received was not for the purchasing construction. That was entirely for the construction. The purchase, they've already put some money to the side for that, and that was not a part of the grant. I just wanted to clarify that.
Thank you, Supervisor.
Yeah, thank you very much for the clarification. But, you know, ultimately, I know we're just talking about the property, but I do want to congratulate the LTA and APC for the $13 million grant that they were able to get. So that's some phenomenal work for our local community. That's going to really benefit us. Okay, any more discussion on this item as far as appointing the negotiating team that has been brought forward by administration? Any more comment from the board? Seeing none, we'll go ahead and open it up. Is there any public comment on this item, Carol?
I don't have any, Mr. Chair, for this item.
Jake, can you open up the room? See if we have any comment.
Yes, I will. All right, the room is unmuted. If you would like to make a comment, please state your first and last name.
Okay, hearing none, we'll go ahead and bring it back to the board for action. And there's two parts. There's only one part. I apologize. Go ahead, Bruno.
I just wanted to ask about a potential timeline. I know when I spoke to the admin department, there was a request to look for a title company to help with the process. Obviously, we're putting the negotiating team together here. I know that the first availability of funds that they can request for the $13 million grant that they've received, and I'm speaking of Lake Transit Authority, can be obtained in August, but I believe it needs to be submitted for around late May, early June or something like that. So I was just wondering if we had a potential timeline of when this process may be completed.
Well, we're ready to meet as soon as Lake Transit is ready, and the title company is poised and waiting. We've already begun the preliminary work with the title company, and what they need is the terms of the sale in order to move forward. I think this can happen quickly.
Perfect. Okay. And if there's no further comments, I move to approve the request to appoint negotiating team for the sale of a portion of the surplus property located at 7175 South Center Drive in Clear Lake, California, APN number 010-043-52.
Is there a second? Seconded by Supervisor Crandall. Okay, Carolyn, go ahead and call for the roll call vote.
Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
And program development. Carol,
Thank you, Mr. Chair. Our tax administrator, Patrick Sullivan, is here in the Zoom room waiting to present this. He's talked to you about this before when we came to your board and got your approval to apply. And we have since been notified that we are successful. And so I'll leave it up to Patrick to fill you in.
Okay, floor is yours, Patrick.
All right, good afternoon. So this is the cannabis equity grant that we brought before your board on March 3rd, and our application was submitted. Last week, we were notified that we had received $150,000. And the uses for this, because of the type of funding, it's the type 1 funding. This is what allows us to both conduct an assessment that the state requires and develops the demographics that we then use to create our actual program. So there's funding allotted for both parts of the process. The state allotted $60,000 to pay for consulting services for the assessment. And then $90,000 was allotted to cover both staff and consulting costs for the program development section. This year, mostly cities were awarded, but Mendocino County and Humboldt County received funds, and it was a little over $2 million apiece. So that's what we're hoping to be able to apply for in January. As long as we can complete all of these necessary steps, we'll be able to apply for that primary program funding, the type 2 funding. So the 2 matters before your board today is first, the resolution. The state requires the board of the governing jurisdiction to pass a resolution that would authorize the county administrative officer to complete the grant agreement. And the second section is regarding the equity assessment and program development, how your board wishes to approach that. The other counties, our neighboring counties, Humboldt and Mendocino, they used Humboldt State University, the California Center for Rural Policy, to complete the assessment. It worked out well for both of them. Humboldt State is the only operator I'm aware of in this region that is doing this. The other entities that were awarded funds were in more urban areas. So given that Humboldt is able, Humboldt is both able to, Humboldt State rather, is able to complete the assessment and do so within the budget that the state's allotted. So what we're wondering is how your board wishes to proceed on that section, whether you want to go through the normal competitive bidding process or whether you wish to waive that requirement and have us proceed with employing Humboldt State. And I'm happy to answer any questions you may have.
Supervisor Sabatier, go ahead.
So I don't think that Humboldt State has done a bad job because obviously they've helped provide some good funding for both Mendocino and Humboldt. But I also know that the Blue Ribbon Committee is working with the Centers for Community and Regional Development, I think it is. I forget what the group name is from the Blue Ribbon Committee, and they're from UC Davis. Yeah. Obviously, they have some knowledge about our community as well, where Humboldt State may have to start from scratch, wondering if they might be an option to link up with them and see if they can help us out with this equity program.
I can make inquiries. You said the center was at UC Davis?
Yes.
Okay, yeah. As far as I know, Humboldt State is the only entity that has participated in the equity assessments at this point, at least in Northern California. The other cities, or the cities involved, apparently mostly use staff time and sort of some auxiliary consulting services, but I can look into what's at Davis and see if they offer something comparable.
Okay, Supervisor Crandall.
I have a connection for that. I can get in touch with you on that that connection with the Blue Ribbon Committee for the UC Davis group.
Okay, and then our primary concern, and I'm happy to follow up with Davis. The primary concern here is just the amount of work that is necessary to complete this in time to apply for the funding in January. So ultimately, what would the direction be on that part, or would we be looking to report back after I try to follow up with Davis, or then would we want to go into a normal RFP process?
Very good question. At this point, seems like we have a couple of different viewpoints. Go ahead, Supervisor Sabatier.
I was going to say, we know HSU does it, and we know that they do quality work. Let's see if it's possible to make it easier with the UC Davis group, because they do know us and they have some good demographic numbers already, because that's the basis of part of their study. It's not just the lake, it's about the communities as well. But if you can get access to them, just like Supervisor Crandall offered, and you get a no answer, that's not what we deal with, then I would say automatically go with HSU.
My thoughts are it's the first time we're moving into this process. I think Humboldt State has proven they can do it at this time, and the ultimate goal would be to get something completed so we could tap into the larger amounts of money and ultimately benefit the county. So my thoughts would be at this point moving forward with Humboldt State. I do know we have the relationship with UC Davis; it's much valued, but those are my thoughts on it at this time.
Mr. Chair.
Yes.
This is Nita. If I could just, I'm sure you know all of this, but obviously if you're going to waive the bidding process, you'll have to declare the basis for that.
Yes. And that would have to be brought in a different item that couldn't be done today.
Yeah, we're not asking for that today. We don't have a contract today, but we were.
Then they can't go forward with selecting a contractor, is my point.
Yeah, absolutely.
You can't give direction on a contractor if you're not doing a waiver.
Thank you, Anita. Apologize.
Okay, so then the only direction, the only board action we're requesting today then would be to adopt the resolution.
Yes.
So we can secure the funds.
And Part B will be brought back in a separate item on a different agenda. Correct?
Yes, that
Make
would
the
be our
contract.
intention.
Okay. All right, is there any, Supervisor Sabatier?
I'm very interested once we get into working the equity assessment program to bring those discussions back to the board. I'd like to see how we're moving forward with that and what the criteria is we're choosing to create and submit to the state for the full funding. So as we move forward, if we can be apprised as to how things are moving along and how we're looking at using those funds from the state.
Yes, we can definitely keep your board informed as we go through the process.
Thank you.
All right, if there's no more comment from the board, we'll go ahead and open it up for public comment on item 7.4. Carol, do we have any comment on this item? Okay, Jake, do we have any comment?
I have no raised hands, but if you would like to open up the floor, I could do that.
Yes, please do that.
All right. Okay, so the floor is unmuted. If you would like to make a comment, please start with your first and last name.
Okay, hearing none, we'll go ahead and bring it back to the board for action.
Mr. Chair, I move to approve, or I offer the resolution.
Thank you.
Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Yes.
And Supervisor Simon?
Yes.
Thank you.
All right, thank you. Moving on to item 7.5. Consideration of an urgency ordinance establishing temporary safety protocols upon the reopening of the county facilities to the public during the ongoing COVID-19 state of emergency.
Thank you, Mr. Chair. I put this on your agenda, but all the hard work was done by Anita Grant, who prepared the draft, and I am grateful to her for that. After she prepared the initial draft, we batted it back and forth a little bit. We had the department heads give us some comments on it in terms of what it would mean for them to enact this in their various facilities. And then we also, for the courthouse more specifically, I had several exchanges with Krista LaVere, the court executive, who was in the meeting earlier today, but could not stay the entire time. So what you have before you is what we consider to be a rough draft. There are still some problems with it, some concerns with it that I'm sure you have already identified. And so I think maybe it'd be helpful if I call those out to you and then we can open it up for an interactive dialogue, because we're really hoping that with your insight, we can address some of these issues that we know have created some concern about our ability to actually enforce it. And so although this would apply to all county facilities, I want to first focus on the courthouse and making this happen at the courthouse if it does. Through the court executive officer, I'm told that in an average week between 350 and 400 people come through the security checkpoint. But the court opines that as many as 40% of those may be people that are going through multiple times in a day. So our guesstimate is that probably 200 to 300 are people that come in once a week, and we have been looking at this for a variety of reasons, including if this was adopted in this way, it would include our need to build up capacity to provide masks for the public if we do provide them free of charge. But one of the greatest concerns that remains in this draft is in section 2A, and how or if we would enforce the rule around in-person interaction. Presently, this is written in a manner that's very consistent with the policy you adopted last week for county staff, and it requires that all persons who enter our facilities and engage in an in-person interaction, which means face-to-face or close proximity, not otherwise protected by a 6-foot separation or a protective shield, would be required to wear face masks or coverings of their own, or a face mask that we provide to them free of charge. But how would that be enforced and regulated to ensure that people were complying? How would the masks be provided free of charge at the front of buildings? And again, not just the courthouse, but the courthouse is probably one of the biggest challenges because we share it with the state court entity. So would we be expecting that security would pass out masks and deal with it if somebody refuses, or would you want us to base county staff up front? So those are some of our questions. In addition, similar to the policy for county employees, we're urging the way this is written now, it urges the public to use to cover their faces when using other common areas of our buildings, hallways, stairwells, restrooms, etc. And then with the elevators, which is section 2B, this assumes that people would wear a mask at all times in the elevator. Your board may want to consider taking a step further. Should elevators be limited to one person at a time? And if so, would that likely have some kind of impact on getting people up to the various floors at the times they need to be? We have concerns we're hoping to talk through with your board about how staff or security would deal with it if somebody refuses. And then in section 5, we discuss, this is similar to the direction you've already given department heads to make arrangements to provide services in ways that are not in person, as we are doing now while most of us are sheltering in place. So if somebody says they can't wear a mask, they contact us ahead of time, they cannot use a mask, then section 5 assumes that that staff would be much like they are doing now, making alternative arrangements to provide services without the in-person contact. So those are some of the concerns, and you probably identified more that we're hoping to hammer out in discussion with you today.
Okay. Well, ultimately, I think, what's right on there, we're looking to protect our employees and other folks that come into the building. Yeah, you bring up a lot of good points. The providing the mask, who's going to do those things. So, like your discussion of the board, it seems like every time we try and move forward with something, there's another conversation that needs to happen. So, we'll continue down the line and see if we come up with something. I do know we've heard right here in public comment and other things from some of our employees that they are concerned about, folks coming and going from the courthouse and other departments and dealing with that. So, trying to weigh both sides here of, combating the coronavirus and keeping people safe at this time. So, go ahead and open it up to the board.
One of my concerns popped up right away on the beginning of section 2, where it says, as soon as the County of Lake begins the gradual process of reopening county facilities, because we still have some facilities that are open right now, and I don't want to wait for a future decrease in the shelter in place. I think these need to be in place as soon as possible to protect the employees that are in a place that's open. For example, we have people walking to the courthouse right now, and so saying as soon as the county begins the gradual process of reopening, I think it's just, if in a public facility, county-owned public facility, these are the rules until further notice, until COVID-19 is over, or whatever it is that we say for an expiration. The enforcement of it all is tough. I'm almost wanting to say it's like no shirt, no shoes, no service, no mask, no service. If you want to come in here and you want to interact with our staff, then please be mindful and wear a mask. And I think that it should be as simple as I don't want to see staff time being spent on that. I can understand that we don't have control over security on this, but I think we need to set a table with a giant sign that says no mask, no service, please pick up a mask. I don't know, the enforcement part of it is difficult, but I'd hate to see us spending staff time and paying somebody to interact with every single one of these people to hand out a mask. That doesn't seem like a safe thing to do, to have someone interacting with everybody that walks through the door. So that's my take so far.
So Carol, are we going to do hazard pay after the shelter place is lifted? Or we're going to call it with the employees?
You're referring to the essential worker leave?
Yeah, whatever that. We changed the name of it but you know what I mean.
Essential worker leave. Those that are approved to receive it, and I still need to have the discussion with the department heads. This information that they haven't heard yet, but for those that are approved, payroll will process all of them at once, and it will be available starting.
It's not related to when the shelter place is lifted?
No.
Okay, because the reason I asked that is because we're talking about doing this once we open back up, and I'm assuming that's somewhere around the shelter in place. For some people, that may be what that means. But for me, I'm going to go back and a reminder of how this conversation came when we were talking about that extra pay. It was because of the risk that our employees face because of the public. And when I said there's no public coming in right now, it was shown that there's still some on the 4th floor, and these people are using the restrooms and they're pushing the buttons on the elevator and they're doing all these things. So that puts our folks at risk for some reason. And so if it's happening now, if that's the whole purpose of why we're having this, why we offered that pay, then why are we waiting until we open the courthouse? It's already open. We have people coming in that aren't employees. They're coming up to the 4th floor. Apparently that was a concern for some of the board members that all that is going on. So why shouldn't they be wearing the masks? If we're serious about it, I mean, if we're not, then, no big deal. But what's the point of waiting until we open the courthouse before we start doing this?
Well, based on what I'm hearing, I think we could strike out in section 2, strike out that whole first sentence and just start it with the following safety practices must be observed while the state of emergency continues to exist or until otherwise ordered by the Board of Supervisors.
Yeah.
And then, okay, then that brings me to the other question, who's going to enforce it? And what are the sanctions if they're not followed?
Very good questions.
Because we have a lot of rules already because of this that are only punishing the law-abiding people. The people that don't care, they're doing whatever they want. No one's really doing anything to them. So I just want to know what the plan is here with that, or is it just going to be we're going to have a rule in place that's not going to be enforced? Anybody? I don't care.
The enforcement, the enforcement issue is definitely a challenge at this point. If you bring it up, I don't have an answer of someone standing there making someone put on a mask. That's a real challenge. That's not going to happen. But we'll be having those conversations down the road. I think being prepared for it. I think we heard Dr. Pace talk about today as we're loosening these restrictions. At some point, there may become a mandate for masks in the public. So if there's a mandate out there that coming into the office, at least we should be having something. Bruno touched on no shirt, no shoe, no service. There are things that you put up as, other agencies are able to do, but don't have a simple answer for the enforcement portion.
Well, that's a major component of it. So that's what I just curious.
Well, it's certainly true that if there was a county-wide order for the wearing of masks, you wouldn't necessarily need this. There probably would still be enforcement issues, though, that would be addressed. And,
that was my comment. The enforcement issues.
Yeah, and we readily acknowledge that enforcement is a big concern, and again, that's why I refer to this as a rough draft. And we were hoping your board might have some insights on how this should be done, if it is to be done.
Supervisor Scott.
Does our staff have the ability to not give somebody service if they don't have a mask on? Just like somebody comes into a store, they have the right to refuse service. Is that something that we can do? I know it may, cause issues with people, but is that with our ability?
I'm going to let Anita address that one if she would.
That's actually in the rough draft of the ordinance, that people who refuse to wear a face mask may be refused service. And certainly you can do that because the board is entitled during conditions of an emergency to take action to protect its staff and the rest of the public who wants access to a public facility. So you can do that. What happens if someone says, well, nuts to you, I'm going to stand here and scream? That becomes another issue. And as Carol pointed out, there is presently no public health order requiring masks. So your board's only controlling the building. I suppose, you could have someone escorted out, but of course that takes staff and raises issues, and you don't want me doing it, for example. So the enforcement of this becomes problematic in the present situation.
And then just to continue with Supervisor Sabatier making the comment, he doesn't want to see staff time in front there. I agree. I don't think we should be using staff time. If security if they're at all able to, have masks there and be able to, give a mask to somebody that doesn't have one. I don't know if it's also on that same line. I don't know if we should put it in this ordinance, but children under the age of 2 should not be wearing a mask. I don't know if that should be written there.
The other thing that should certainly be discussed, it's a potential hindrance to adopting an ordinance like this is the availability of masks and the costs of masks. We presently have somewhere in the neighborhood of 2,000 available. Is Lars Ewing still in here? Lars, if you could speak to that. We had some masks left over from fires that we would start with, but there's going to come a point where we may run out. So if Lars, if you could speak to the number of masks we have, the number we think we have coming, and cost, I think that would be helpful for the board at this point.
Sure. Thank you for introducing that. We have on hand round figures about 2,000 masks. They're expired N95 masks that have been, I'll just say, decertified by public health for our use. We have ordered in the interim to have on hand other masks that are not N95. They're I don't know what you would call them, just kind of basic face masks. We've ordered about 1,200, and they're coming in piecemeal. We have, I think, 450 that are due just about any day. The rest of the 800 or so are being sent as they're available. Price on those is about 38 cents per mask. So hopefully that answers that.
So we began acquiring them, anticipating the need for staff, but we'd also need them for this purpose. And going back to the data the court was able to share with me, if you assume we have 300 or so people coming into the courthouse every week, we probably have a 6 or 7 week supply until we get more.
That's when it's full capacity.
Yeah, we're talking about,
true.
I thought you said 300 a day.
No, it's 350 to 400 a week.
Okay, that's when the courthouse is closed.
Yeah, so, that's a regular week.
Yeah, so we're gonna triple that or more when the courthouse is open, because you're gonna have 400 just going to the 4th floor a week.
Actually, that information was for a regular week, not a COVID situation.
Okay, I understood you to say that was happening right now. That's what was happening right now. So
no, very few people are coming in now.
Okay.
I thought we still had 300 people a week too.
The court has also, we haven't really gone to talk terms yet, but the court has expressed an interest in possibly sharing the cost, but it's a sizable cost. And right now we're talking about the courthouse, but there's every other facility as well, that county facility that would have the same issues. And Crystal Marketan, for example, of Social Services, has shared some information indicating the volume of masks that would be needed for the public in her facility that gets considerably more traffic than the courthouse. And we're just talking about one of her facilities. It's the main office at Lower Lake, and my computer is freezing up on me. But anyway, something in the neighborhood of, I don't know, thousands of masks, not hundreds, thousands.
Yeah. Supervisor Crandall, I know you had your hand up. Still on mute.
I had a question for Anita, possibly on section 4. It says persons who refuse to utilize a face mask in either of the above described situations may refuse service. Would it be out of the question to say something like, and those, or those who refuse to utilize a face mask by asserting their constitutional right to do so? Is there a way to put it to where they can't? I mean, because they're gonna do it, just like you were saying earlier. Some people are gonna say, I'm not gonna use a mask, and you're discriminating against me for not allowing me to come to court where I pay taxes or something like that. Is it too much extra work to possibly say something like, well, here's a document saying you're asserting your rights, or you refuse, or something, so then that way it takes care of that? Because some people they're going to not wear a mask.
Well, I think I'm sorry, Mr. Chair, is it all right if I respond?
Yes, go ahead, Anita.
Thank you. I think you could look at that kind of an issue, and people are going to have those kind of issues. The problem with it is if you let them fill that out saying, well, I'm just not going to, there's still a danger to the people in the building. So, at that point, you're going to have to decide how you want to address that. And quite frankly, there's no real good way to do this when you're talking about a public building and people having access to services. That's why the ordinance is replete with so many questions, because this is a complicated area. And your board is acting, again, to protect county facilities and the people in them, but there's no public health order that relates to it directly. So you don't have quite the same health support that you might otherwise have.
Okay, Anita, thank you. Go ahead, Eddie. Go ahead.
No, I was just thinking out loud. That's all. And I thank you, Anita.
Yeah, Bruno. Before I go to y'all, just one comment too. One thing that's always overlooked when we talk about you need to have a mask to come in the building. I know we are going to have to provide some, but I know there are a lot of folks in the community that are using different type of facial covers, other things like that. Got to consider that as a safety issue too sometimes. But there are other things too. I know we talk about N95 masks that we currently have and other things, but it's been made very clear the N95s and those types of masks should be left for our health providers, our nurses, the ones on the front lines, our EMS workers, and coming up and using some other types of masks. Also, just lower ones that I see people out in the public using. They aren't N95s; they're more like a painter's mask or something like that. So we're assuming we have to provide one to everyone, but I know there are responsible people out there that currently have different opportunities, are taking advantage of, hey, all the stuff they're seeing on the news, a handkerchief, a covering and other things like that. So Supervisor Sabatier.
Thank you. A couple of things. One, I think that we need to look at the ordinance. Right now, we are not doing a mandatory mask via Dr. Pace. May come in the future, may not come in the future. I've already made myself public in my stance that I just don't think it's something we can enforce. And so there's no sense in putting in a rule that we can't enforce. However, here we're looking at an ordinance where we control our buildings, and it could be a good lead by example for other businesses to look at copying and pasting so that they also enforce these types of safety guidelines for their staff and their customers and things like that as we slowly open up. So I think that's an important part. And I think that the right to refusal of service is the enforcement. If you are coming to my window and you don't have a mask on, then I'm going to turn around and get my 6 foot distance until you come back and you have a mask on, and then I will come to my counter and I will help process whatever it is you need me to process. I think everyone's aware of the situation. We've all had the chance to wear a mask, especially over the course of the last 4 or 5 years, whether it's because of smoke or fire or COVID-19. It is not a difficult task to ask somebody to just please put on a mask and come in, and then when you're done, you can go ahead and take out the mask when you're off, or take off the mask when you're out. There is one thing that I do want to ask Ms. Grant, and I'm just, maybe I'm going extreme on the legalese of this. Do we need to put anything in here that these guidelines will not necessarily prohibit you from contracting COVID-19? That way, if somebody does a tracing and it goes back to the courthouse, that it doesn't come back to us, that we weren't, that we told them they could come in with these guidelines and it would be safe?
Mr. Chair, if I may?
Go ahead, Anita.
Thank you. Well, lawyers always like disclaimers, so I can certainly add that in. And in fact, in all of these kind of things, and whether it's the public health officer exercising his authority under health and safety, or your board exercising your police power under the California Constitution, all of these things should have some explanation, some justification as to why you're doing it. So once it's more clear exactly how and what form this will take, there will need to be more in the recitals to support that, and also to explain to the public why you're doing something, because they are always entitled to know. And it could very well include something to the effect that while this is not a panacea, while this will not necessarily prevent COVID, it's intended to try to eliminate or reduce unintended spread. Not that I think anybody should be intending spread, but anyway.
And I have, thank you very much, Ms. Grant. And I have one last question, and this one's for Carol, Ms. Hutchinson. Can we looking at this as a required PPE where we can get FEMA to help pay us back for the cost of using this to protect our staff and those coming into our facilities?
Yes, I think that is possible, but it needs to be explored.
Right.
First, seeking the direction of your board if we're doing this, but yes, I think that is possible.
Okay, Supervisor Scott.
I hate to ask this because my feed keeps cutting in and out. When Lars was talking, are we the 38 cents? Was that the N95 masks? And why are we looking at those instead of something a little bit cheaper? Is there a reason for that?
We're not shopping for N95s. What we had some expired N95s left over that we plan to use.
Oh, okay.
But the ones Lars is shopping for are not. So go ahead, Lars.
That's correct. The ones we're shopping for, I should have gotten the name here, and I apologize for that. But they're similar to the painter's masks, or just entry level non-medical masks. They are not N95 masks. They're just what's available on a variety of different vendors, and the prices are fluctuating. But I think that 38, 40 cents a mask is probably reasonable to assume moving forward.
Thank you.
Thank you, Lars. Okay, any more clarification questions or anything from the board? Go ahead, Carol. Carol, did you want to make comments?
Yes, Mr. Chair. So it sounds like you would like us to add another whereas that expresses a disclaimer of sorts that, while this is intended to reduce the likelihood of transmission, there's no guarantee that it will, something along those lines, and Anita will have much better wording for that than I do. And so I'm also hearing that going back to the body of it, section 2, we would drop off anything that talks about a gradual reopening and assume that this just starts from the point you approve it. We should pursue financial participation with FEMA and the courts as well. But it doesn't sound like we're going to make extraordinary efforts to enforce. The masks would be up front in each building with signage telling the public they need to use them. And that, to me, that just sort of sounds like how we would do. I mean, so nobody's going to go around and say you've got to leave if you don't put up a mask. But when the person arrives to be dealt with at whatever department they're going to, the employee then would step back and take social distance and ask the person to please comply. Am I understanding that part well enough?
Yeah, I think that right now, I think that was the conversation that was had, the refusal of service being the opportunity for our employees to say, hey, I needed to pay attention to social distancing, 6 feet separation. Yeah, I think, that what you read back or quoted back was, yes, the conversation. I think that's where we are at this point.
The employee can reference county policy that requires them to socially distance, and so they could conceivably say, I cannot socially distance with you here at the front counter unless you wear a mask. So then any further thought about the elevator and whether multiple people should be in there? And again, I'm asking questions around which there would be enforcement issues there too, but what do you think about elevators?
The elevator's a real challenge. It's supposed to be 6 foot separation. And I think our elevators are 5 feet across, maybe 6. I'm not even sure if that's 6 feet. I don't know the dimensions. Maybe Lars does. Lars is still on the phone. It does create a challenge. It puts the onus on having a mask on. If you're going to go up the elevator, you need to have a mask on.
But if it was just one person at a time, there would be impacts on the flow of people getting to the upper floors. Lars, how big are those elevators?
I don't know. I don't know off the top of my head. I can run over and measure that. Maybe I'll have that by the time we're done talking about this. But I'd be surprised if we can get 6 foot separation in there.
You can't. There's Lars, don't go. You got stuff
No,
on.
it's,
You can't do it.
we know it's too small.
Yeah.
It's going to be real tough on the elevator.
So would you want this to contemplate one person in the elevator at a time?
I don't. Can I say something?
Yeah, Supervisor Burke.
So all we're doing is making a recommendation. This isn't a requirement. You can't. It's not a requirement unless it's enforceable. We're making recommendations. We can put it up there, and you can actually have masks available in front for people. They would probably take advantage of that if they don't have one. Like Moke said, they have them already. They're driving around with them when they're in the car by themselves. So you just have them available, and that's it. I mean, I don't think we even need to create an ordinance. I mean, it's silly to create an ordinance that has no teeth to it. You can't enforce it, and it's just, I don't get this this conversation for an hour now of something that we can't even impose. So it's not. We're creating language. We're making stuff up as we go here, and it's not. I realize the intention, but it's not a real thing. So it's a waste of time. You can't have one person at a time in the elevator.
Yeah.
You got somebody coming in at the second floor. You got somebody on the first floor. The elevator opens up. They're like, "Oh crap! I got to catch the next one." It's not reasonable to expect all this thing to happen. If people want to use the stairs, that's pretty handy. Not everybody can use the stairs. They can use the elevator. And then if they don't want to get on with somebody, that's their business. If they're okay with it, and the other person is not okay with it, then they can duke it out. They'll figure it out. It's not something that we can regulate. It's silly.
So then are we backing away from this entirely?
I'm not saying we are doing anything. I'm telling you what I'm doing, and that's just my opinion. So,
Supervisor Sabatier.
I think that the refusal of service helps enforce this, and it also allows our staff to be comfortable in being able to keep themselves safe. Everybody feels differently about their safety with COVID-19. Well, we also have staff that feel very concerned about COVID-19 and the spread of it. Without this, we could potentially get in trouble for saying, "I can't help you, you don't have a mask." At least if we have this in place, it gives them the ability to say, if you go back and get a mask and come back, I will gladly help you, but right now I don't feel safe with doing that. And I think that if we do that without any ordinance, that we don't, that we have ourselves open for potential discrimination or anything like that. Right now, it would say you have to have a mask, period.
Why don't we put up the little plexiglass? Most of them have glass anyway. Most of the offices do. Why don't they put up a plexiglass?
And Lars has been addressing a number of requests for that. Maybe he could report out on that too.
Sure. Yeah, there have been a handful of them, and I've put the requests out to all department heads for where they think they may need them. Some are pursuing them on their own, whether they're freestanding. Most of them that are pursuing it on their own have the freestanding styles that are on kind of the reception desks. That's been about the extent of it, but there's a handful of them that have them out there, but it's certainly not every single reception desk, though that, again, that note is out there for the department heads to consider.
Okay.
All right. Well, I think Nita and I have heard enough input that it sounds like we would return next week with a revised ordinance.
Yes.
Okay, will do. And before you leave it, I know you probably need to open it up to the room, but I also have one piece of public comment that came in via email.
Okay.
Are you ready for it then?
Yes, go ahead, Carol.
So this comes to you from David Van Cleve. Not really understanding why the mandate to wear masks is only while in county facilities. Either make it mandatory in public or several other counties have, or not mandatory at all. What makes county facilities more important than other public facilities? With all the non-essential travel orders in place, they can't possibly see more activity than Walmart, Safeway, Food Lines, seems a little prejudiced to me. The virus doesn't have discretion. It can affect anyone in any building. Sonoma County and several other counties have mandated masks and facial coverings in public. They've also enabled a way to enforce the mandate. The last update was that approximately 350 citations for not complying. It can be done, just requires a little more effort. It's up to you to decide if the lives are worth the effort. I'm all for opening the county back up, but it needs to have strict regulations. Otherwise, you'll see a free-for-all mentality with total disregard for health and safety. It's scientifically proven that wearing a cover over the mouth and nose can drastically reduce the spread of the virus among asymptomatic individuals. I just don't understand the hesitancy to impose a temporary mandate. It's pretty simple, mandate that all residents entering public buildings are required to wear a mask. If businesses or individuals aren't cooperating, they're fined or temporarily lose their business license. Again, this is temporary and may save lives. And anyone that can't understand that doesn't have the intellect to serve on the Board of Supervisors. Sorry, I'm just reading. As someone that's married to an active Sonoma County RN, I can tell you with certainty that their response and proactive approach to this virus has been phenomenal and has without a doubt kept many people healthy and saved lives. I'm certain that Dr. Pace would be in agreement. Thanks, David Van Cleve. That's all the public comment by email.
By email, okay. You know, obviously, I think just to want to answer back to him from our point of view, this is what we have control of the Board of Supervisors at this point. We're always constantly working in consortium with the public health officer on his mandates and orders in the county, making suggestions where we feel appropriate. But this is something for our offices and our employees that we're able to try and implement. So any more comment from the board? I mean, sorry, we're in public comment. I apologize. Jake, can you open up the room?
Yes, I will open up.
Comment from department heads or anybody in the room.
Okay, the floor is unmuted. Would you like to make a comment?
Yeah, somebody's unmuted. Okay, hearing none, I guess we'll go ahead and close it up and bring it back to the board. Supervisor Sabatier.
I was just gonna elaborate a little bit more on what you were saying, Supervisor Simon. Right now, we are not getting any green light from Dr. Pace to go for the full-on ban, or not full-on ban, full-on mandate to put a mask on when out in public. And I don't, at this moment, foresee us doing that before he is looking to do those things. And nor do I think that at this moment in time we should be telling private businesses how to operate their business. We should lead by example and affect the one that we are, affect the ones that we can affect, which is our employees and those who come into our facilities. And I think that it's a good place to start at this moment in time. And even though the enforcement, I will admit, is rather weak, I think it provides us at least some leverage to be able to provide the safety net for our staff and those coming in.
Okay. So I think Carol and Anita, obviously you've heard direction from the board. We'd like to have this thing brought back, tighten it up with some of the suggestions we have, and we'll look for this item to be brought back to the board.
Got it. Thank you.
Thank you, Mr. Chair. We'll keep working on it.
Okay. All right, moving right along to item 7.6, addendum, consideration of a letter to the Board of Barbering and Cosmetology requesting restrictions be lifted temporarily to allow barbers and hairstylists to go into the homes of their clients to provide services during the COVID-19 crisis. Supervisor Brown.
So this came up at our blue collar committee meeting. Several, literally hundreds of barbers and salon owners around the county this has affected. The governor's orders closed barbershops and hair salons, but did not close down barbers and hairstylists. And so it's not anything that Dr. Pace would have anything to do with. This is a rule that's imposed by the Board of Barbering and Cosmetology that won't allow folks to go into as a normal practice to go to private homes. So we're asking that the Board of Barbering and Cosmetology lift that restriction during the shelter in place, and then establish policy that will allow for it if in the event that shelter in place comes again. It's twofold. First, there are people that need that service for whatever reason, whether it be for their own health, their own well-being, or whatever. But these people need to work too. A lot of them don't qualify for a lot of the programs that are available through the government funding and all that. So, as long as they practice safe practices with capes that are disposable, gloves, masks, everything that's required. And if the client is okay with it and the person coming into their home with it is okay with it, then it should be between those two. So that's what I'm asking, that we send this letter.
All right, Supervisor Sabatier.
So just to clarify, you're saying it's the place of business that has been closed down through the state mandate, not the activity of barbering or styling hair?
Yes.
Okay, which is why you're requesting that a policy change within the barbering and hairstyling industry to allow them to go into homes.
That's
okay.
what I said, yeah.
Okay. I just wanted to clarify and make sure I understood it correctly. And I know I talked to you about it earlier, but I was still slightly confused. I've been discussing hairstyling with a lady who owns a hairstyling salon here in Clear Lake. I've asked her to put together a policy on how to remain safe, and her policy was spot on as far as I'm concerned. We're gonna have to figure out how to make this work, and I'm definitely okay with asking to see if we can make this change, because we got to find ways to make this work. So, thank you for bringing this to us.
Supervisor Crandall.
Yes, this has been discussed quite frequently in the Blue Claw Committee, but also I know some folks on the North Shore that cut hair, and these are the same things that they've been talking about doing. I can just go to houses, but they haven't, because they don't want to break rules. But they're like, if someone gives me consent, I don't see why it's an issue. And so I do like a letter, because it puts people that want the service in an opportunity to get their hair cut or whatever the case may be, and then also gives someone an opportunity to actually do some work that they're wanting to do. So.
Okay, thank you. Supervisor Scott, do you have any comments on the letter?
I like the fact that we're looking, outside the box to try to get things done, but I do question if this is really going against the order put in place, the shelter-in-place order, by having people go to home. I mean, I like the idea that we're trying to figure this out, and I guess with consent of people coming into your home, but I think it seems like a slippery slope of,
Well, as it is right now, that person can still invite that person into their home. So now they're actually going to come in and provide a service. They're already doing massage therapists, personal trainers, things like that. So I don't know how this is any different. There's no slippery slope here. These people have people come into their homes now. It's not against the law. It's just against the law for this person to actually cut their hair because of a rule from the Board of Barbering and Cosmetology, not because of any of our rules.
Okay. And this letter is actually asking that they could go into the homes of their clients that are approving it. Yeah, these are real challenging times. Too, when I read the letter and everything, the concern would be, the 6 foot distancing. But coming up with protocols is what we're going to be looking forward to with all of our businesses as we come out of this thing, and understanding the dangers that we're dealing with, and also what we got to do with PPE. It sounds like Supervisor Brown, you've talked to him extensively, and Supervisor Crandall about wearing gloves, masks, disposable things, and stuff like that. So, yeah,
and those were all solutions that the industry came up with. It's a very highly regulated business to begin with. They go through a lot of stuff. In fact, what was described to me is they do their board's test, and the test kit that they use is the kit that they would be using in this. It's for the exact same purpose: disposable. Everything, the towels, the cape, everything is disposable, and it's for the same purpose, for safety of the client. Because let's face it, the coronavirus isn't the only thing that these folks are exposed to unless they take safety precautions. You're dealing with people one-on-one that could have anything. So there's a lot of safety that's required on a good day in this industry. So I think these folks really are prepared to handle this appropriately and safely. And again, it's up to them and their clients. If the client doesn't feel comfortable with it, don't call them. If the stylist doesn't feel comfortable going, don't go.
Yeah,
very simple.
And it's like all the industries and businesses owners here. Everybody's thinking about this stuff as we move forward. So, all right, we'll go ahead and open it up for public comment. Carol, do we have any public comment on this item?
I don't have any on this item.
Jake, can you open up the room and see if we have any comment?
Yes, I will. All right. The floor is unmuted. If you'd like to make a comment, please state your first and last name.
Okay, hearing none.
Mr. Chair, I would move that we authorize the letter to the Board of Barbering and Cosmetology and authorize the chair to sign.
Did you have a comment, or are you seconding, Bruno?
Quick comment before we go to the second. I just want to say that I did, most of these workers are independent contractors, a lot of them. Just wanted to say that as of today, EDD has opened up for independent contractors. So if you're unable to get work, or you still have a huge reduction in your income, then please continue to follow the EDD process. It has just opened up. Second.
Thank you for bringing that up. That is something for independent contractors, 1099 workers, and all that stuff. It is open, and please apply early because it is taking a long time, as we know, for some folks to get through. So, all right, is there a second to Supervisor Brown's motion? Seconded by Supervisor Sabatier. Okay, go ahead and call for the vote, please, or the question, please. Sorry, call for the roll call vote. Carolyn.
Supervisor Sabatier.
Aye.
Supervisor Crandall.
Aye.
Supervisor Scott.
Aye.
Supervisor Brown.
Yes.
And Supervisor Simon.
Yes.
Thank you.
Okay, we have one more item. We have our calendars. After we do that, we'll go to closed session. So go ahead, Supervisor Scott.
My calendar's pretty open. I have 11 o'clock Zoom meetings every day talking about the room key project. I'm assuming we'll be putting in some meetings for the restaurants and the seniors. If you need to get a hold of me, my telephone number is 849-4414 or tina.countyca.gov.
Thank you, Tina. Supervisor Sabatier.
Thank you. Looks like tomorrow we have another EOC meeting, as well as on Friday. I'm going to be joining CC4C for their meeting, Citizens Caring for Clear Lake. They actually submitted an AARP grant for, I believe, between $5,000 to $15,000 to continue their cleanup efforts through the city of Clear Lake and outside. I don't have much on my calendar other than that, but meetings seem to pop up regularly every single day as we try to douse the fires that we catch. And so I'll keep working on that. I do have one question while we're on this calendar, and that is In the past, we were talking about economic development. We were supposed to follow up with the process that we had somewhat put into place, and then this happened to us. And I would suggest that now is more relevant than ever to have a discussion about economic development and have something prepared and planned, ready to go. And I would like to know if we have any ability to keep moving forward on the process that has kind of been prohibited to continue that we started earlier this year.
So as you know, we had dates, we had a range of dates scheduled where we planned to bring in department heads that were grouped in similar ways. We were going to start with the departments that are most focused on infrastructure development. This was a follow-up to the workshop we had earlier in the year. And we had those scheduled, but then all of this happened. So we haven't returned to planning to schedule those, but honestly, to me, it looks like we'll be doing this in virtual mode for a while. And if your board would like me to get those scheduled, even if they're, they don't have to be all-day workshops or half-day workshops or anything, but to begin that dialogue with those groupings of department heads, I'd be very pleased to get that started.
Yeah, and I'd like to see if we could kind of go along the same lines with Dr. Pace. Obviously we just opened up a little bit this weekend. It seems like there's going to be some changes coming up in the next week. So, if we can kind of move along those lines and be prepared and get ready and start scheduling maybe for the end of May into June and stuff, I think those are good times. I think the next couple of weeks are going to be, it was 3 hours this morning on the COVID-19, and I think with a little bit of loosening that's happening not only here but around us, I think we can just kind of take those timelines and move forward with that. But we hear you loud and clear, Bruno. I agree. We got to be ready to keep rolling, and I appreciate all the hard work that the departments have done to keep us moving in that direction. Community development, environmental health, everybody that's doing the things they need to do.
Just as an update, and Eddie, I'm not sure if Eddie was going to chime in on this, but we've actually been working on this too from the business side of it through the Blue Collar Committee and Jeff Lucas and the Chamber of Commerce working on it, on some suggestions from the business side of it to add to that as well in anticipation of trying to hit the ground running as soon as we can and everybody cooperating together. So
yeah. So we'll report back to you. Me and Carol can get back to you on that one, bro.
Yeah, absolutely, Mr. Chair. We'll look at some dates as soon as we can.
Okay. Supervisor Crandall?
Yes. So, that has been a lot of discussion with the Blue Collar Committee. The other thing is, another thing when it comes to economic development, I've been meeting about with a group called Cook Alliance. This has been an initiative for quite some time, AB 626, about folks that want to cook in their homes, have their own home kitchens. And so they're preparing to discuss this in order to allow other opportunities for different folks who may not have the opportunity to keep staying open during this time. If we can work on this, which I'm trying to bring to the agenda here shortly, it might be an initiative for people to cook from home and be able to, suffice that way. But aside from that, I'm meeting with them either today or tomorrow. Friday, I have the Blue Collar Committee meeting, and then the COVID recovery meeting. Monday is the Middle Creek Restoration Committee. Is that correct, Bruno? Middle Creek Restoration, would that be Monday? But yeah, I think we have that usually Middle Creek Restoration.
I didn't click on Monday, but yes, okay. Yes, 10:30.
Okay, just making sure on that. Yeah, and so that's my week. And then if you need to get a hold of me, 707-533-3385. I've been getting emails and phone calls, texts, things like that, and I try to appropriate the issue or the person to the director or however we can resolve the issue as of now. So,
thank you. Supervisor Brown?
Yeah, I can't open my calendar when I'm on my iPad here, but I'll try to go by memory. I know we have a North Coast EMS meeting this week. I think that's on Thursday.
What time is that on Thursday, Rob? I'll check my emails.
I'll give you the information on that.
Okay.
And then blue collar committee on Friday. I don't have a whole lot of other stuff scheduled. I'm pouring 50 yards of non-essential concrete this week too. So, so it's going to be, everything's going to be in between that. So I'll let you know about the CMS.
Okay. Thank you very much, Rob. Yeah, meeting today, obviously have agenda review afterwards. I have been asked to join Assemblyman James Ramos on a tribal town hall discussion tonight. I think this afternoon at 4. Yeah, the same thing. I have the DOC call tomorrow. I did miss the Region 9 call yesterday. I hosted our risk reduction authority meeting. You know, obviously we have fire season coming up. Went over, you know, to have that meeting keep moving forward. I got some pretty good information from the clerk folks here in Lake County. They've got some real good stuff going on. That's I'm excited about. Will Evans reported on it about yesterday of some fire break programs and other things all around the county, which is very encouraging. And also tying in the Risk Reduction Authority on a potential grant proposal too this year. So we're excited about that. And so we had the Risk Reduction Authority meeting yesterday. Moving along the rest of the week, have the Friday afternoon recovery and reopening throughout that, just coordinating, and also the DOC meet call on Friday, and just taking calls from constituents and moving forward through this process. I just want to thank everybody for making sure we can have these virtual meetings and everything, and appreciate all the work that's being done by the supervisors, because I know each and every one of us are being contacted constantly, and appreciate that contact being taken care of by each and every one of you. Thank you so much. So that's it for my calendar at this point. I'll go ahead and read closed session items. We have 2 items. Item 8.1, conference with real property negotiator and government code section 54956.8, property APN 01043-042 7175 South Center Drive, Clear Lake, California. Negotiating parties. Lost it. Sorry about that.
So please give me 5 minutes to stand up the closed session.
Yeah, I got to finish. Sorry about that. I lost
it.
Okay. Negotiating parties, Lake County Administrative Office, Lake County Transit Authority, under negotiation, price to purchase payment. All right. And then 8.2, conference with legal counsel, existing litigation pursuant to government code, section 54956.9, D1 EEOC, charge of. So we'll come back in 5 minutes, correct? We'll get a new invitation.
Yeah, it'll be a different invitation. Thank you.
Okay, so 2:55, is that what we have? Okay.
It's 2:50. So we'll be back at 2:55, correct.
Okay, all right, thank you.